It's going to be the Chris and Kerry Show. Good evening, everybody. It's Chris here from the Whistle Stop Cafe in Mirror, Alberta, but I am coming to you from Mirror, Alberta as the Chris in the Chris and Kerry Show. And
that's right. And I am Kerry in the Chris and Kerry Show, the shorter of the two, as you quickly pointed out, the APP event this past weekend. And I'm actually not, believe it or not, I am in my van, but I'm not in Mirror. I'm in Calgary. I'm waiting patiently to get into an event today. There's so many things going on. Chris called me the other day and said, look, we've got some interviews coming up. Can we do this on a certain date? And it was like, yep, I can only do it Sunday and Monday because the rest of my week is busy.
And then I picked every other day.
He literally picked every other day. So, but you know, I have my cloning machine hasn't actually worked out yet, but we'll figure it out. So, I'm doing this from the van right now, so I'm kind of limited to what I'm doing. But I did want to bring up a couple of things before we even jump into this, if you don't mind, Chris. There are a lot of events going on, and I think what people need to do is, I get this question all the time. How do we find out about the events? Well, we usually try and post on the Chris and Kerry Show. We usually try and post on social media with the Chris and Kerry Show, or we'll even post stuff directly on the Whistle Stop. If none of that works out for you, go to our good buddy Max's website. It's called freedomcalendar.net. And I'm not sure if Chris is capable of pulling that up. Freedomcalendar.net has everything for pension, everything in terms of independence, anything to do with COVID and lockdowns, et cetera. Max has done a wonderful job doing events up with that. And so I did want to give him a shout out to that. Thanks, Max, for all the effort that you do. I am actually at, the event is called the Burger, Pints, and Politics, and it's at Brickwell Tap House in Calgary. We've got John Hilton O'Brien, who's going to be speaking in regards to Parents for Choice in Education. We also have Rob Smith, who's the president of the UCP board, as well as our good buddy, Tanner Naday, who is speaking on behalf of the Alberta Pension. And that's why I'm here today to deal with a lot of questions in regards to the pension. So that's why I'm doing this. And there's also another event that I did want to point out. Obviously, it's probably too late for us to get there, but at the Palace Theatre in Calgary right now, it's called Generation Green, and it's a movie about exposing what is going on in schools and talking about what is the green agenda and how it looks great on paper, but what's actually going on in real life. So I did want to bring those three because, again, that's what's going on, three being this one as well. But that's exactly what's going on in and around Calgary. And of course, anywhere else around Alberta, go to freedomcalendar.net. So now, Chris, I will pass this on to you.
Well, I just want to say, first of all, I thought it was Kelly.
No, it's Terry with a T.
Oh, Terry with a K. Right. Yeah. You know, the green agenda actually looks better on recycled paper.
That's
especially that recycled paper that you get with your ice cap now. You know, the one where you halfway through your ice cap, you get a
Why are they still doing paper straws?
Do you know why? It's all about the Benjamins, Kerry. It's all about the money.
Of course,
you know how much money Walmart makes on their reusable bags now instead of the plastic? By the way, did you hear what happened when the plastics ban started and Walmart stopped using plastic bags?
Then they went to paper or what? I'm not sure.
They threw out millions of pounds of plastic bags into the landfill to make way for the green agenda. Anyway, that's a whole nother story. We could probably spend 3 or 4 days on it. But tonight, we have something that I would say is much more important, at least in the immediate short term. Our guest tonight is Dr. Byram Bridle from the University of Guelph in Ontario. And if you folks recall, Dr. Bridle was one of the first scientists who sounded the alarm about what the government was doing in relation to handling the pandemic. Specifically, he's been speaking out regarding the COVID-19 immunizations. And, in the beginning, I remember watching him say, hey, if this is the path they're going down, not only is it not going to work the way they say, but they're also going to have to do it a couple times a year. And people said, oh, no, you're a quack. You're a conspiracy theorist. Once we reach 70%, it's going to be done and we'll be back to normal. Well, here we are in 2024, and we are on booster number 8, I believe. And the real crazy part is we've seen, the numbers are in, the data is there, the statistics are there right from the government's website, that the COVID-19 children, youth were statistically at a 0% risk of that. And now governments all over this country and health departments are authorizing using that immunization in babies, even like 6 months. So we have
even the dangers are coming up in mainstream media.
Yeah.
If you look at the Edmonton Journal, you look at Toronto Star, they've actually run stories on these. And unfortunately, I'm limited to what I can do right now, but I know I wanted to pull up a couple of those examples to show that. And one of the reasons why we have this brilliant, amazing doctor coming on to talk to us about this is because there's actually an event going to happen next Monday, and it's called An Injection of Truth. So yes, we totally ripped off the name of this episode from that. It's An Injection of Truth. It is on Monday, June 17th at 6 p.m. And I have some information about it, but if you want to know more, go to showpass.com, buy your ticket. All you have to do is just go and search for injection, or you can do Injection of Truth. You will find what's going on with that, and it tells you where it's at, who's involved. Our good buddy UCP MLA Eric Bouchard and the CA president Daryl Comack from Calgary Lougheed. They're putting this on, and there are, Chris has already shown that up on the screen. You can always make that font a little bit bigger, Chris.
I don't know how to do that. I'm actually going to read it because nobody wants to read the little writing on the screen. So here it is. You can find this at unitedconservative.ca/events/an injection of truth town hall, all with dashes in between. And here is the summary of what this event is going to be about. Calgary Lougheed's An Injection of Truth Town Hall project is grassroots activated. Working with an all-star cast of doctors and scientists, An Injection of Truth Town Hall will provide current scientific data, victim statements, and regarding the negative impact of the COVID mRNA injections on children. Speaker panel subject to change. The development of a panel of experts is in progress. Currently, we have confirmed the following participants. Dr. David J. Spiker, Dr. Eric Payne, Calgary-based pediatrician, who we also met in Ottawa. Dr. William Mackus, a radiation oncologist who we've spoken with many times. Dr.
Buddy.
Chris Shoemaker, that's the What's in the Japanese Nakara study. Dr. Jessica Rose, who recently testified to the U.S. Congress about the plasma DNA in the injections. And Dr. Byram Bridle, Canada's leading virology authority from the University of Guelph, who is going to be joining us tonight. He's actually waiting patiently in the background. We will hear from families who have felt the pain of COVID mRNA injections. After the formal town hall, there is an after party called Politics and Popcorn, where you can mix and mingle with the speakers and Alberta MLAs. The Politics and Popcorn ticket include admission into the town hall. It is a 2-event combination ticket. They have also added a 3rd event, which is dinner with the scientists. I think it's $3.99, and I think there's only 16 tickets available. There will be 15 tickets after I buy mine tonight, and probably 14 after I get in trouble from Jessica for not buying her a ticket as well. So hopefully you'll be able to go. Anyhow, that's what it's all about. And awesome. I think it's we should bring Dr. Bridle on right away so we can absolutely hang in the background. So there we go. Dr. Bridle, welcome to the Chris and Kerry Show.
Hi, Chris. Hi, Kerry. Yeah, it's great to be here. Thanks for having me.
Thank you.
Yeah, my pleasure. It's been a while.
It has. Yes, since the trucker convoy in Ottawa.
Yeah.
And a lot has happened since then.
Yeah, no kidding. That was
way too much to talk about.
Yeah,
man.
Yeah. Well, you know what? At that time, when I reminisce about all the time that's transpired, I recall back it was even prior to that. I was trying to get the message out that as much as I was concerned about the lack of public health officials and government officials following the real science when it came to COVID-19 policies, I was starting to see a pattern and an infrastructure, right, that was emerging that I saw that I feared was going to start being applied to everything. This was going to go beyond COVID. And that's what I think about it all the time since I last saw you guys is one of the things that stands out at the top of my mind. I never thought I would ever in my lifetime live to see the day where in Canada we would start vilifying farmers, for example, right? So people are going to keep cattle, or if they aren't going to cut their accept massive cuts to their use of fertilizer, that these farmers are going to start being vilified and labeled as some kind of ecocidal maniacs, right? It's crazy. But I think what we've seen is a strategy, people, a way of thinking, a way of thinking now that's spread to so many other aspects of society.
Yeah.
And you've been sounding the alarm for a while. We invited the government of Canada, scientific advisors and politicians to basically a debate in Ottawa. None of them showed up. There's many people trying to say,
That's
hey,
right.
we need to full stop here. We need to figure out if this is safe or effective before we continue. And it hasn't happened. It's continued on. Governments across the country are pushing it. And now we have things like this happening, which is why the grassroots in Calgary Lougheed has put on this event. So
yeah. Chris, with you saying that, I really appreciate having received an invitation to come to this event in Calgary. And you're right, it hasn't happened yet, but already it is reminiscent of what I went through when I was in Ottawa. When I was in Ottawa, an invitation was, as you pointed out, put out to Teresa Tam. There were a few individuals. I remember Shelley Deeks was an individual. She was the co-chair of the National Advisory Committee on Immunization, which was advising on these COVID shots. And I had driven back home, and I drove 6 hours, on my own time back to Ottawa to engage these individuals in a conversation for the benefit of the public, and they didn't show. And then I see this event in Calgary. You know what I appreciated? I was actually invited after representatives from Alberta Health Services had received an invitation. Some of your greatest so-called and self-proclaimed misinformation experts, or gurus, as I like to refer to them as, and those people declined the invitation. Well, actually, I didn't find out until after I accepted the invitation, right? I knew the invitations had gone out to them. And again, I'm thinking, well, this is excellent. This is exactly what the public needs. Whenever there is an issue where there are, serious disagreements, and especially when there's so much confusing information out there, right? And the public really wants to know what experts can they trust, or which experts can they trust. The best way to do it is through conversations, respectful, open conversations. And I don't care what the so-called misinformation gurus claim. The best way by far to evaluate expertise and to identify who a real subject matter expert is and who really has the overwhelming or overall weight of the evidence supporting their messaging is in real-time discussions. Because when you're in real-time discussions, you can't mask a lack of expertise, and you can't mask an absence of science. Where you can, if you don't engage in real-time conversations, right? We all know anybody can go, if you have a debatable topic and you go and you have enough time to Google something on the internet, you're going to be able to find something that seems supportive. And that's what these so-called misinformation experts do, right? They might come back, if they even come back with any evidence, right? They'll come back with some cherry-picked piece of evidence. And then people get confused because it seems like, well, maybe they do have some expertise here. No. If people aren't showing up to a public discussion for a topic that is of incredible public interest, Straight up, I can tell you that's because they aren't standing on a solid scientific foundation. Period. I don't care what excuses they give. That's the only valid reason why they're not showing up. And so I do hope people will show up. I have heard, when this was announced, Chris and Kerry, I couldn't believe it. When the website first went up for this event, this Injection of Truth event, I saw, and all of a sudden the public started making me aware. There was, legacy media, especially legacy media in Calgary. Recently, somebody sent me a Toronto Star article about this. It's been all over. I've seen your local Order of Canada recipient and misinformation guru, Timothy Caulfield at University of Alberta, advertised by legacy media. I mean, I couldn't believe these people have lost their minds. I mean, it's really quite incredible. Talk about emotional triggering. It's absolutely incredible. But one of the things that surprised me is they're saying, we're looking at this event and the names that you just listed. And it seems like sort of only one side of the debate is represented. People need to know, again, I was invited after the misinformation experts, and representatives of Alberta Health Services. They declined. And that says something, right? And so I think it's very important, because this is being hosted, like you said, by an MLA, an elected representative in Alberta. If these people actually care about what the public think, they need at some point in time. Come on, it's been 4 years now. At some point, especially when you're serving Alberta Health Services, or you are an academic in a publicly funded university, recognize that you're a public servant. Get out of your chair, get out away from hiding behind your computer screen, and get in front of the public and be willing to answer their questions. Anybody is welcome to ask me the toughest questions they have. I take any questions and I'll answer them honestly. And if I don't know the answer, I'll let people know.
So anybody in the comments right now that wants to ask Dr. Byram Bridle a question that maybe is totally from left field, that could stump him, or maybe it just says, well, according to this expert, this is exactly what was going on, and people are so much better off. Please put those in the comments, because
try and challenge them. I've watched that before, and it's great. So I just put up let me put it up again real quick. This is the reason why we're doing these types of things. So Dan Hartman lost his son Sean shortly after he received his COVID-19 vaccinations. There was never really, as far as I know, there was never really any investigation done to it. So at this point, it is a temporal correlation, as in the timing suggests that there may have been something going on there, but nobody's bothered to look at it. And this is one of thousands of stories of like heartbreaking loss in families that has a temporal correlation to their people receiving these immunizations, these shots, these jabs, whatever you want to call them. And I think it's worth looking into. I mean, when in our lifetime did we ever hear that the majority of deaths that are happening around us in our province or country are unexplained? If we have that type of a problem, if we have unexplained deaths in children, we should probably figure it out and try and prevent it from happening more. And that's what this is all about. Those experts who we have either who have been hired by the people we elect to do this type of work, won't engage in this conversation. And that, to me, is that's negligence in the simplest form. So we definitely have a problem here. We need to fix it. And if we're going to fix it, first of all, we have to find out what exactly the problem is, so that all those gurus of fact checking can stop contributing to the heartbreak we see happening around us. So, Dr. Bridle, what are some of the things that you want to talk about at this event? Like, what's your position on what you see going on around us in the in our healthcare around the COVID-19 shots right now?
Yeah, so I when I spoke up about my concerns, I really focused right from the get-go. So we're talking now, almost 4 years ago. I expressed concerns related to the children. My very initial concern was the speed at which the COVID-19 vaccines were being developed, that so-called warp speed program. Let nobody kid you. Many corners were cut. We now understand just how big some of those corners were that were cut, that it took actually several years. And by that, I'm meaning a great example is the DNA contamination. In fact, we found out that all of the shots are badly contaminated with DNA. So I've got a good colleague, Dr. David Speaker, who's been leading that research here in Canada. He'll be talking about that in Alberta. But that's an example. So that was my initial concern. Then I spoke about some draconian policies for children. So and where I live in Ontario, we were one of the very few school districts that had this incredibly draconian policy they tried to impose. So my youngest son had a classmate test positive by the PCR test for SARS coronavirus 2. It did appear that he did end up getting mild COVID-19. It was mild cold-like symptoms for a few days. But every student in the class was sent home, and with a letter from a local medical officer of health asking us to place our children into what they called isolated quarantine. When I read this letter to my family, my older son, when I was done, asked me, why do we have to put Johnny into solitary confinement? And initially I started to correct him and say, no, that's for criminals, right? And it actually dawned on me. There are actually limitations on how long you can place a human being into solitary confinement. And what they were asking us to do with our children was way beyond that. They wanted us to lock them up in their rooms, their bedrooms, for 2 weeks, isolated. My youngest son, he has Down syndrome. And he wasn't allowed to go outside, and he was perfectly healthy, and he was perfectly healthy the entire time. And some parents gloated over how they embraced this. And I kid you not, they bragged about how they put their child's dinner on disposable plates and use disposable utensils, so those could all be thrown out, and literally would have their child go to because these were in the instructions, have them go to the back of the corner of their bedroom. Then you crack the door open and you slide their dinner in on the floor and close it. There was no way I was going to do that. So I went public. I immediately went outside in the driveway, which was not fenced in. And they were only allowed to go outside if they were essentially caged, so fenced in, or on an outer balcony, as long as they couldn't access the street from the balcony. And I know, we stay on our property. I went outside where he wasn't fenced in, where we like to play basketball, took a picture, sent it to the newspapers and said, look, I'm an expert, and I want all parents to know you do not have to feel compelled by public health officers to abuse your child. They cannot compel you to abuse your child. This makes no medical sense whatsoever. So that was a concern. And then the third one was with the COVID shots, right? I'm a vaccinologist. I have made all kinds of vaccines throughout my lifetime. And by the way, with the intent of helping people. I noticed that for this event coming up, I noticed legacy media. It's been very interesting. I know a lot of I've become quite an expert with propaganda over the past several years, and now I see these things very clearly. I noticed that your legacy media out in Alberta, for example, has misspelled my name. In some cases, they don't refer to me as a doctor or an associate professor, right? That's an indication of disrespect right there and not recognizing my expertise. They also try and make it out or insinuate somehow that I am a veterinarian or only practice veterinary medicine because I'm located at a veterinary college. And they don't seem to recognize the reason why I embedded myself at a veterinary college is because I can do far more advanced research than I can at a medical school. I was at a medical school, and I was offered a position to be a professor and work at with the University of Ottawa and at the Ottawa Hospital. And I declined that to go to the veterinary college because it actually allows me to do much more advanced animal research where I can work with cats and dogs with natural infections and natural cancers. Otherwise, and I can still do the same research I do at a medical school. Which often I like to playfully refer to as verminology, right? A lot of so-called human-focused research that's aimed ultimately for the benefit of people is actually doing research with mice and rats. So I can do that. Plus, I can work with cats and dogs and other animals that naturally develop diseases just like people do. And this was well recognized. So I got very hard to obtain funding, like from the Terry Fox Research Institute. They loved this concept. But of course, your legacy media tries to make it out as this guy's a vet. Look, they're bringing a vet in. That's how desperate they are. No, I had a vaccine technology, just so you know, that went into 4 human clinical trials. So I know what I'm talking about when it comes to vaccines. And I saw the science going way off the rails early on. And not even to revisit even some of my original concerns. There's something very interesting. I just want to ask you guys, because if people were to get informed consent, I just want to ask you, because this I find astonishing. Do you guys, with all of the public messaging, do either of you guys realize that the Canada has, so does the Public Health Agency of Canada or Health Canada disclose to you that we have an official immunization guide? It's called the Canadian Immunization Guide. It was published long before they declared the COVID-19 pandemic and still exists to this day. You can go to the Public Health Agency of Canada website. If anybody just Googles Canadian Immunization Guide, you'll find it. And so did you know, A, that we have a Canadian Immunization Guide, and B, that we have an official definition of an ideal vaccine for Canada? Do you guys recall hearing that public message?
No.
I rather suspect that you didn't. Most people I ask haven't. So this is the amazing thing. So now tell me this. If this sounds like a message that you have heard routinely or regularly through the legacy media or from Health Canada or the Public Health Agency of Canada, people like Teresa Tam and so on. This is our official definition of an ideal vaccine in Canada. It is an ideal vaccine is one where you give a single dose and the person is protected from the disease for the rest of their life.
Yeah.
Right? Because what do we hear? Safe and effective. We are safe and effective, safe and effective. And we're told these are very effective vaccines. We have a definition, like I said, of what an ideal, which also means an effective vaccine is, right? What an ideal effective vaccine is. You give one dose and the person is protected from the disease for the rest of their life. Now I recall the conversations you guys had in the introduction there. We are talking about, yes, officially people up to about 8 booster doses. There are some people who are beyond 10 now. And they induce incredibly suboptimal immune responses that are anything but protective against the disease. And again, like you said, so put that into the context. So when Health Canada is disclosing this stuff, what they are supposed to be doing is taking their official definition. That's why we have it, is so that we can take any vaccine that exists and place it into the context of our official definition. So again, a single dose and you're protected from the disease for the rest of your life. So how do these COVID-19 shots compare to that gold standard? Well, they're obviously so far off from meeting that definition of an ideal effective vaccine that it's hard to still keep them under the umbrella term of a vaccine, right?
But there's another side to that.
As simple as that. We can be as simple as that, right? That is not a public message that they've been giving people.
There's another side to that, though. An ideal vaccine that you give once and you're protected for the rest of your life is not very lucrative. I mean, that's a very poor way to access tax dollars through health. Very poor.
Hey, I'm a cancer researcher, and I will tell you, I have been I'm not appalled anymore because I've been kind of conditioned to it. But when I'm at cancer meetings and you listen to big pharma representatives of big pharma companies, I mean, they openly admit what the ideal model is for treating cancers. And it is not some magic bullet where you give, a single treatment and the person is cured of cancer. The ideal is a drug where the person has to take that drug every day for the rest of their life. And as long as they take it every day for the rest of their life, they're going to feel 100% healthy, right? And they're going to have an incredible quality of life. But you have to take that drug every day for the rest of your life. That you're right. That is the model. Whether people like it or not, right? These big pharma companies, at the end of the day, people have to recognize maybe scientists start these companies, but very quickly their boards get taken over by, out of necessity often, with investors and investment companies, people who are driven by a financial agenda. You're absolutely right, Chris. That's the reality. Pharma's ideal model is treatments as often as possible because you're right. That's how you continue to generate money. A good quality vaccine, you're right, actually is not a big money maker because indeed, as our official definition says, you get one dose and you're done. Think about in the context of the fact you guys said we have all these Canadians that have taken 8 doses now. So it's 8-fold more lucrative already than an ideal vaccine.
Yeah, and this ties in with some other conversations we've had. As a matter of fact, you've met Mr. Sean Buckley, correct? Do you remember him with the NCI? So Sean Buckley, he was involved in some litigation with Health Canada, both for Health Canada and then later on against Health Canada. And he had one of the Health Canada reps on the stand, and he was trying to get them into this little box, you know how lawyers do, to get them to answer a question the way that they want them to answer. And he said, so, you know, as Health Canada, your job is to ensure the health of Canadians, correct? Or would you agree with me, or whatever they say? And the Health Canada person said, no. And he said, well, what do you mean? And he got it out of them on the record in court that Health Canada is not about our health. Health Canada's job is to protect the intellectual property and patents of pharmaceutical companies so that they can continue to operate and manufacture the pharmaceuticals we need. Because if they don't protect it and someone can just go out and copy their drug and make it, well, they've spent $1 billion on testing and research and getting it approved. Nobody would do it. So, you know, what you're talking about here is it's kind of scratching the surface of the deeper problem we have here. Yes, we have a problem with a drug that's on the market right now being given to Canadians, even ones that don't need it. That's a problem. But the bigger problem is that the whole structure is set up to not benefit the people of this country or the provinces, but to benefit the people who bring these products to market. We're compelled to pay taxes. We're compelled to support socialized healthcare in this country and in our provinces. And then these companies can access those tax dollars almost freely with things like this. So this is a really, really big problem. And it's something that we're going to have to deal with. And I'll say it, I've said it dozens of times, I'll say it again. All paths lead to Alberta independence. But for now, we really need to focus on mitigating the damage that's occurring because of this problem. And now that it's kids that are at risk, that's why people are starting to take action. So how do you figure?
Yeah.
How do you figure we can start to deal with this? I mean, if our health professionals like Dina Hinshaw with a couple years of medical practice before becoming a bureaucrat, if they won't have these conversations and bring this information to government, how do we ever get legislation changed to protect us or to protect our kids? What are we supposed to do?
Yeah, well, I'll be flat up honest, especially. I mean, I've seen Dina Hinshaw work, and I've seen her messaging, and I'm sorry, it's my opinion that individuals like her need to be removed from their position. They have shown, in my opinion, utter incompetence in trying to guide us through this the declared COVID-19 pandemic. So we need to take people, remove them from these leadership roles, those who didn't understand what they were doing, weren't willing to engage in open conversations, weren't willing to hear differences of opinion and take those into consideration. Right. Instead, they surrounded themselves with a whole bunch of yes people who thought the same way. There was only a singular narrative that was allowed to be perpetuated. So I think there needs to be leadership change, and there needs to be change in the structures of these systems. There's no question. I couldn't agree with you more, Chris, and I couldn't agree more with Sean Buckley about what you just said with Health Canada. Many members of the public don't realize, they think, well, this is a government agency, so I'm paying them through my tax dollars, and therefore they should be serving me as a Canadian taxpayer. No. So interestingly, decades ago, Health Canada's budget primarily did come from tax dollars, but it has switched, and it switched. It was largely driven. They observed what was happening with the United States Food and Drug Administration, and they said to our government, hey, we want to be like the United States Food and Drug Administration. We see that they're getting the majority of their money, the majority of their budget is coming from Big Pharma, and we want that. Health Canada craved that and sought that, and for some reason, our government granted that system. So people don't realize right now, well over 80%, and it's probably more than 90%. It's hard to get the exact figures, but the reality is the vast majority of the budget that Health Canada works from, that they have to spend, comes from Big Pharma. It's the fees that Big Pharma pays to have their applications reviewed is what constitutes the vast majority of Health Canada's operating budget. And it's just a classic concept. You don't bite the hand that feeds you. So to me, one of the things we need to do, I'll tell you, with how much tax we spend and the fact that taxes keep going up, I would be personally happy to have some of my tax dollars diverted again to Health Canada or a system like that if we were going to redesign, design a new one. But the point is, have a taxpayer-funded system for a regulatory agency such that the hand that they don't want to bite will be the taxpayer's hand and not Big Pharma's hand. And let me give you an example. People can go the Health Canada's website, and you can see right now the fee structure. The fee structure, it reads like it is a business that's service-oriented towards Big Pharma and providing them with the best service possible. So, for example, I kid you not, if you're a new company and you come to Health Canada, they'll give you your first review for free. And then after that, when you apply, you pay fees. So, for example, the fees now are well over $500,000 for review. So, for example, when Pfizer came if they get their shot approved, right, for the emergency or the authorization by interim order in Canada, they would have paid. Well, at that time it'd be a little more under $500,000. Now it's the fees over $500,000. So they pay that fee. They're paying Health Canada. To review their own application. Now, this is the thing. And then Health Canada's built-in performance standards. So they've told pharmaceutical companies, if we do not get the review of your application done within 6 months, we will refund you 50% of that fee. So now you think about it. Say now you're a scientist at Health Canada and you're undergoing this review and you're trying to evaluate the science. And you have to go to your manager and you say, you know what, this is very complicated and there's a lot of work here and there's a lot of questions. I'm going to need more than 6 months to do this. That manager is going to place pressure on them. You do realize that if we go past 6 months, we have to give more than $250,000 back. And that is the salary of you and one of your fellow scientists for a year. So you can see the pressures. I mean, this is just natural business pressures. So people need to understand Health Canada is driven and then by the dollars from Big Pharma, not from taxpayer dollars. So this is absolutely correct. The financial structure incentivizes Health Canada to please Big Pharma and not worry about taxpayers, because you know what, whether we're happy or not with them, we never are going to make or break their budget. Right. And their jobs are never going to be impacted by us and our tax dollars. They're always going to be impacted by Big Pharma. That is the setup. We need to change that setup, Chris. If we're going to change this, we need to completely change that. And we need to get back to having a regulatory agency that is accountable to taxpayers. I mean, my goodness, when it comes to scientific questions, as we've been learning, and we've been seeing this through Freedom of Information requests, when it comes to what we've learned recently about the massive DNA contamination in these shots, which was never supposed to have been there, they keep deferring to the companies. Oh, well, it's on the company. The companies ran the test. The companies provided us these reports, right? The companies didn't tell us, didn't indicate, their data didn't indicate that there was an issue, right? There's no requirement for objective third-party research to confirm anything that these companies do. It's ludicrous. So as long as that exists, as long as Health Canada exists with its current leadership and with the current financing structure, we're never going to have taxpayers placed first by Health Canada. That's just the reality.
Yeah, they're very smart when it comes to accessing the tax trough. I know in the United States, Dr. McCullough was on the show and he was explaining that in the United States, they actually just passed legislation, but they simply passed legislation that made it illegal to treat any disease or sickness with anything other than a pharmaceutical. So natural remedies by default are illegal. In Canada, all pharmaceuticals, this is the way Health Canada works, folks, if you're not aware. In Canada, every pharmaceutical, every drug is illegal. The only way to get a drug to market is to get a permit or an exemption to use that drug, and that's Health Canada makes these companies go through this process. They have to pay them these exorbitant amounts of money. And then Health Canada says, okay, we will give you an exception for, drug XYZ to bring to market. That's how this works. So if you want to bring a drug to market in this country, you have to pay a huge amount of money to Health Canada. Health Canada rubber stamps it. And actually, when it comes to the COVID-19 injections, if you go back on our interview with Sean Buckley, he explains to you how the Minister of Health in the Federal Minister of Health actually changed the way this all worked. And so just allowed it without any of the process being followed, kind of like what they did in the United States. Thank you, Mr. Trump, for that one. But it's quite sickening. So if you believe for 1 second that our health departments are about our health, they're not. It's about money. It's about access to tax dollars. And the only people that are actually concerned for your health besides you are probably the frontline workers that are trying to help you and deal with you every day. So this is something you have to keep in mind. And it's really something we have to keep in mind when we're having these conversations, because it's generally the frontline workers that you and I interact with. It's not them. It's way above them. That's where we got to start. So
yeah, guys,
this
mentioned something, Chris, because you brought up a great point, and I want your listeners to understand. Now, there's a big target that's been placed on natural health products in Canada, which I find quite incredible. They actually want to place the regulation of natural health products under the same set of regulations that apply to synthetic drugs from these big pharma companies. And it's going to destroy the natural health product market in Canada. People have to understand that this is going on right now. It is very dangerous. So what are we talking about when we say natural health products? It's things as basic as vitamin D, for example. And I can't emphasize enough, Chris and Kerry. For example, I think back to early on when the COVID-19 pandemic was declared, and our former federal minister of health, Patty Hadju, who is not an immunologist and has no expertise, but she somehow felt that she could declare to all of Canada that vitamin D was fake science in the context of infectious diseases. I can't emphasize enough, the vast majority of Canadians, even in the middle of summer, when you're outside and getting exposed to the sun, most Canadians, even when they're exposed to the sunshine in the summer, are still, research suggests, deficient in vitamin D. And it depends on the definition. Not deficient in terms of bone physiology, right? So our current recommendations for dietary intake of vitamin D, for example, are focused on bone physiology. But I like to explain it like this, Chris and Kerry. The body, it's like a house. You're not going to worry about what paint you're going to put on the wall, right? And what decorations you're going to put up if the foundation and the framing of your house is garbage. First, you're going to make sure you've got a solid foundation and a solid frame. Then you put on your drywall, right? Then you can paint or do whatever you want, decorate. The body's the same way. If you have a limited amount of vitamin D, the skeletal system takes the bulk of it. It goes there because that's literally the framework for our entire body. It gets diverted there. It gets preference. And then the leftovers go to the immune system. So what research shows us is, when I say deficient, I'm talking about deficient in the context of optimal immunological function. And the immune system, like I said, I'm also a cancer researcher. The only cells that can compete and even outcompete in terms of the metabolic activity of cancer cells are cells of the immune system, especially when they're responding to a disease like SARS coronavirus 2 when it infects. And so the metabolic requirements are sky high. So long story short, from that's what I'm talking about when I talk about the vast majority of Canadians are below what research suggests is needed for optimal immunological function and optimal protection. So just to give you guys an indication, and not that the numbers or units don't necessarily mean anything to you, but let me just tell you, there's a lot of research, especially when it comes to breast cancers. That's where I've seen that the concentrations of vitamin D, that's when it really kind of pushes the immune system to its absolute limit. And it's been shown that for optimal protection against things like breast cancers, you need 60 nanograms per mil in circulation. Let me also put this in perspective. Research showed that anybody who had a concentration of vitamin D above 50 nanograms per mil in their blood had almost a 0% chance of getting severe COVID-19, right? And yet the majority of Canadians are probably walking around with less than 25 nanograms per mil. So they're way off from these standards. And so we can't just write off natural health products and let them do this, hurt the natural health product area. We need the natural health products have always traditionally been an inexpensive way for people to make sure that they have optimal health. And if people, just the vitamin D, had we promoted that research about vitamin D, I can't even begin to tell you, I can't even guess at how many lives would have been saved and hospitalizations would have been prevented. Wow. Not just from COVID-19, but from all diseases. Because again, the immune system is involved in combating all diseases. And this is the thing then, Chris. You also mentioned the Health Canada protecting intellectual property. Interestingly enough, my life was changed upside down, back in May of 2021, because I did an interview. And in that interview, I disclosed to the public research that I had obtained from the website of the Japanese Health Regulatory Agency. And that's when I discovered that we had been lied to. That's what was shocking to me about this data. It was biodistribution data showing that these COVID-19 shots got distributed throughout the body. And it's interesting, because my shock was not the systemic biodistribution. In fact, when I saw that aligned with my understanding of the history of research in this area leading up to the declaration of the COVID-19 pandemic. But you know what got me off track is because everybody, if you remember at the beginning, saw that these were genetic-based vaccines. They were delivering genetic material to our cells to get our cells to manufacture the spike protein from the SARS coronavirus 2. And a lot of people were worried, will this genetically modify me? And trying to assure everybody that would not happen. The public messaging was literally, no, you don't have to worry about that. Trust us, although it's a relatively new technology, especially being deployed in this way, it functions like traditional vaccine technology. And it stays at the injection site. They specifically stated that because that was the example they were giving of how a traditional vaccine technology works. But you know what threw me off, Chris, and why it took me finding this Japanese biodistribution study to tweak to what was going on, was because of what you just said. Because they don't disclose all of the proprietary aspects of medical technologies, right? And so we have been given a partial ingredient list of what was in these vials, but we were told that there were proprietary aspects that were not being disclosed to protect that intellectual property. So I, as a scientist, had trust and faith in Health Canada that if they're telling me that, and I'm hearing the same message from them that these stay at the injection site, they're like traditional vaccine technologies, I am trusting them my understanding therefore was that there must have been a proprietary tweak that stopped this technology, which for all of its history got systemically distributed throughout the body, to one in which it stayed at the injection site. So my colleagues again got so emotionally triggered when I raised this science. My concern was at the time I was so shocked because the argument started being, oh no, there is not systemic biodistribution. These don't get distributed throughout the body. This guy's lying. And I'm like, really? Have you guys not been following the history of this entire field of science? Because that's how it has always behaved. And so what I was shocked about was not the scientific finding. It was realizing that I was being publicly lied to. Like everybody else, up until that moment in time, I had placed my faith and trust in places like Health Canada, and all of a sudden what I saw on paper was they are outright lying. They're outright lying to us. And now, of course, all the literature since is wide open. Of course, there's systemic biodistribution. It's been well documented now, despite the fact people use that to destroy my very career. But it's interesting because I'm going to link this right back to where we started, Chris and Kerry, because people don't realize that, because I was never given the opportunity to explain. I got fact checked to the wazoo after being able to talk for only 9 minutes to a lay audience. I'm talking off the cuff in a radio interview. And then that's the thing. Everybody starts saying, this guy's spreading misinformation. This guy's spreading misinformation. Your listeners need to understand, I was not given an opportunity by one person. I still haven't. Like we were just talking about, even going out to, I will travel. I'm showing the willingness. I will travel across our country to engage others in conversation about this. And 4 years, I've not been able to get anybody to engage me in conversation. I've never been granted the respect to be able to explain myself. So let me explain this now, because people need to understand this. So yeah, there's all this research now that shows, yeah, I nailed it. Of course, there's the systemic biodistribution. There's all kinds of peer-reviewed scientific literature now specifically about these COVID shots. But this is what you have to understand. That is how it was for the more than a decade that this technology was being developed. This technology was originally being, so these lipid nanoparticles, these little fat bubbles, right, in which we package these modified RNAs, these synthetic RNA molecules, these genetic blueprints for the spike protein. Those lipid nanoparticles were being developed originally for gene therapies and to deliver drugs. These companies were dreaming, and for those purposes, they needed these lipid nanoparticles to go far and wide through the body. They dreamed of treating things like brain cancers and Alzheimer's and Parkinson's disease. And this is the interesting thing, and this is where it comes full circle, because what I'm going to do is I'm going to tie this now to Canada's a definition of an ideal vaccine. Most people, and I realize that this is why I'm being very vocal about this now, because I realize, you know what, we have to go right back to the basics, because I can make no assumptions as a scientist and an immunologist. And I realize now the very basic fundamentals were not disclosed to people. There is a reason. You know what the one and only reason is why these lipid nanoparticles were deployed as a vaccine technology? It's very interesting. The entire rationale for them being deployed as a vaccine technology is because of Canada's official definition, which matches the textbook definition, in any immunology textbook. And that is that you give one dose, maybe you give a couple doses, and the person is protected from the disease, not dampening of the severity. They're protected from the disease, and they can't transmit the causative agent. That's the only way you can achieve herd immunity, right, is if you can actually get individual immunity, which means you're protected from the disease and you can't transmit. So after a single dose, and the reason is, what you guys need to understand, and there's this interview that was done in 2016, but the literature is full of this. I mean, it's right there in the peer-reviewed scientific literature. Any scientists that didn't disclose this, are misleading the public. These big pharma companies knew the problem that they encountered when they used, so let me just give you a quick example. I mentioned brain cancers, treating brain cancers. If you're going to use these lipid nanoparticles to deliver chemotherapeutic drugs, think of anybody who has a cancer. They have to get multiple rounds, many rounds of chemotherapy, right? Many doses. If you look at children, they'll often they'll get in pediatric hospitals, cancer hospitals, they'll get these what we call bravery beads. They'll be these huge necklaces. They'll often end up with 5 or 6 necklaces, huge, hundreds of beads. On every bead represents an individual treatment that child has received to treat their cancer, right? So you think about the number of doses that are required for these chemotherapies. And this was the problem they found. Multi-dosing with these lipid nanoparticles was well known to be toxic, very toxic. And so this is the thing that people have to understand. This is in the literature. We know these lipid nanoparticles can be toxic to individual organs like the kidneys and the liver. There's systemic toxicity they can mediate. Remarkably, do you know what one of the published toxicities is for these lipid nanoparticles? They are toxic to the cells of the immune system that gobble them up.
Oh, yes.
We call these phagocytic cells, specifically, for example, macrophages, right? If anybody knows about immunology, they may have heard of macrophages. They kill those cells. Those are the very cells that we need to have a vaccine function properly. We call them antigen presenting cells. So I kid you not, one of the reasons, I could tell you many reasons why these vaccines have vastly underperformed. One of them is that the lipid nanoparticles kill off the very cells that you need to mount an immune response, which is crazy, right? But this is the thing. So they had no toxicities. So what did these companies do? Many of the companies decided to abandon the whole field. So if you look, for example, Roche, Novartis, right? And there's others. There are major pharmaceutical companies, if you've noticed, that did not deploy lipid nanoparticle encapsulated modified RNAs. That's because they had invested millions of dollars, like the other companies, into this. But they were large enough and divested enough in their investments, right, and what they had invested in, and had so many other products that they could afford to walk away from the millions of dollars they had invested, right? They looked at it and said, this is too toxic. We're not getting involved. We don't want to risk it. And they walked away. And then you have companies like Moderna, and I kid you not, the CEO of Moderna had openly admitted pre-COVID that knowing that these were toxic, they were also pursuing this for other purposes. And it was Moderna started to lead the way, right? So Moderna was different. They were all in on this lipid nanoparticle technology. They were a startup company. So the millions they had invested in the research and development using these lipid nanoparticles, that was their lifeline. If they could not afford to walk away, they were all in. If they walked away from it, they were done as a company. They had to deploy the technology. And so people started thinking, okay, when we administer these lipid nanoparticles, first of all, if you want to use it as a gene therapy, you want it to be a stealth technology. It was not a stealth technology. We call these things, they're quite immunogenic. They cause a lot of inflammation. You've probably heard the term, people have been referring to them as reactogenic. They cause a lot of inflammation. They grab the attention of the immune system. So that's not a stealth technology for deploying a gene therapy. But people thought, oh, you know what? If for a vaccine, we need something that tells the immune system there's something dangerous here. But this is the more important. They realized, you know what? The only way we can deploy this technology is if we use it in a way where it only requires minimal dosing, ideally one dose. Do you see where I'm going with this? That's why it was deployed as a vaccine, because we all know that a good quality vaccine requires one dose and you're done. Yeah. That's it. And the CEOs of these companies openly were discussing that pre-COVID, that the whole reason for deploying is, yes, it makes sense to use these as vaccines because these lipid nanoparticles are toxic when they are multi-dosed. But a vaccine only requires one, maybe two shots. So now that people understand that, now look again. So that's why that's why our official definition is important. And so what people should have been informed. So I've got many concerns, but here's just one basic example. When this technology was deployed, people should have been told, okay, we want you to know that the history of this technology, lipid nanoparticles, is this. They're toxic if you give too many doses over a period of months or years. But the toxicity is probably an acceptable profile if we only give you one or two doses. And that's exactly why we're doing this. And remember, they were originally approved as a 2-dose regimen. And I'll point out the companies weren't the ones pushing for people getting up to 8 doses. The companies have happily embraced that, right? Nobody was told, right? And this is an ideal vaccine. And as long as we only have to give you 2 doses, and these do function as an ideal vaccine, which means we give you 2 doses, you're protected from the disease, you can't transmit, and now you're protected for the rest of your life. You know what? I would have defended these because that would have made them an awesome tool for achieving herd immunity.
You're right.
But now look at where we're at. They didn't accomplish any of those. So people have to understand that was not disclosed to people. So that's why I'm disclosing it to people now. The very reason these were deployed as vaccines is because they were only supposed to be 1 or 2 doses. Yeah. So those of you who are taking multiple shots, and now I see, for example, Moderna and the US, the FDA has just quietly approved a new modified RNA, lipid nanoparticle encapsulated modified RNA vaccine for respiratory syncytial virus. So people, I'm telling you, go back and look at the historical literature. Just the lipid nanoparticles alone. Forget about the spike protein, which has toxicities. Forget about the contaminating DNA, which has toxicities, etc. Just the basic platform was known to be dangerous if you had to take more than a couple of doses.
Yeah. It's amazing how we were told initially you would get 1 shot, you'd need 2 over, within 6 months, and how the media, or it's just become folklore, that people that have got the shot have now saying, oh no, that was never said. You need more because every variant has its own shot, because that's the only way we're going to keep ahead of this. I have TikToks upon TikToks that are showing in my feed that's what the argument is from the other side. And I can tell they have yet to actually say a doctor's name. They have yet to actually say which study it is. They're just saying they say this, they say that. Where's the they?
Exactly. And that's what the so-called misinformation gurus do. In fact, what they usually do, I don't know if you've read the book I did. It's quite interesting. It's called Turtles All the Way Down.
Yes,
And the concept is that when it comes to vaccines, people are saying, well, we know this vaccine is safe because we compared it to this one. And then you go back and you look at that one, right? And the concept is, oh, but that one that then it wasn't actually designed to properly assess safety, and they claim the safety was because they compared it to the previous one prior to that, right? And you go back to that one, and it's like, well, that one also wasn't designed really properly to assess safety, and that's where the concept comes from, and that's where this comes from. You're right. They keep referring to they, and these people report that individuals like myself are spreading misinformation, right? What they'll say is, oh yeah, look, this guy spreads misinformation, and what's my basis? It's, oh, it was that fact checker from a couple years ago who never allowed Byram to have a voice, never interviewed Byram. And if people want to think about fact checkers, I mean, I could tell you a lot, but let me just tell what a facade that is. Yeah. They typically would send me questions and at the start of the afternoon and tell me I had 3 hours to respond, and then they were going to publish. And I would end up reading this, 3 or 4 or 5 days later because my communications were overflowing. But there were a couple times, I'll tell you, when a pop-up came up and I saw it was a fact checker. I'm like, oh, I actually have time to do this. I sent them all the science. And guess what happens? As a scientist, you spend the hours and you show them that you know exactly what you're talking about. And guess what? They publish nothing. They never publish that fact check and then put on at the end of it, fact check to be true. What they do is they always find they only publish the fact checks where you were unable to respond as an expert, and then they got their speaking heads to respond and give their opinions, right? Which of course was pushing the narrative, and then of course they give the fact check to be false. So and you're right. So that's the kind of stuff that's happened. It's they said, the nebulous they, never pointing to the peer-reviewed science. It's quite incredible. And you know what? This is actually something interesting that I can comment on, which your audience wouldn't be privy to, or your average audience member wouldn't be privy to, because you just reminded me of something, Kerry. Yeah. Criticisms of this event coming up in Alberta. An injection of truth. I've noticed the legacy media trying to say, like, come on, like essentially this whole idea, it's settled science, right? Look, there's all of these experts around the world, who agree on what the science is and stuff. You know what's interesting? I have been in court many times, and you know what I'm going to do? When I come to Alberta, I'm going to bring with me the documents. I showed them once publicly, and that was in Ottawa, when I was invited to have open discussions with people like Teresa Tam and the others, and they never showed. Yeah. I'm going to bring the documents I brought then, because what legacy media doesn't understand, the number of times that I've now served as an expert witness giving testimony, and I've lost track of the number of court cases now. But I'm seeing in court, that in court is where you're seeing, that's the one place we're seeing the data. And I'm going to bring there the report that I received from the expert witness in a case I was involved in, and he was the chair of Ontario Science Advisory Table, advising our government on what our lockdown policies were, what our COVID policies were. And I'm going to bring my report that was sitting on the other side, which was voluminous and full of peer-reviewed scientific data. And his is absolute garbage. And I'm going to show a little bit of the verbiage that he had in there. It was unbelievable. And if I can, I'm going to try and find the transcript from the judge, where the judge criticized this. Basically, it was thrown out, his report, because it was garbage. What he said basically is, Dr. Bridle says, and he would take a quote from my report, and then he would literally say, I disagree, and this goes against the global consensus. Period. That was his evidence. And of course, the judge looks at that. And so people understand, when legacy media is saying these things, don't get fooled. When we get in court and the rubber meets the road, I can tell you where the overall weight of the evidence lies. And mainstream media does not want people to know that.
Here's a question for you. And we should have gone over this at the beginning, but what gives you your standing to make these claims and to speak on this subject? Like, what's your, we know what your title is, but what kind of work have you done that leads you to make these claims?
Yeah. Okay. So So I'm a viral immunologist. I'm trained in virology. I'm trained in immunology. I have a PhD in immunology. I did my postdoctoral fellowship, 6 years of postdoctoral fellowship training at a medical school, McMaster University, where I got trained in viral immunology. My career has been heavily focused on vaccinology, developing vaccines, improving vaccination strategies, evaluating the safety of vaccines. So I'm a scientist by PhD, right? I've specialized, so that's an incredible specialty. Just so people who understand, again, no disrespect to professionals, but if a person holds an MD, they don't have nearly the depth of training in virology or immunology. So let me give you an example. At McMaster University, where I was, they get an average of, well, it used to be they got only 5 lectures in immunology, and about the same with virology, and they might get a few minutes of coverage on vaccines.
Yeah.
So the average undergraduate student, university undergraduate student who takes an immunology course has far more training in immunology, honestly, coming out of their program than the average person with an MD degree. So I teach students at the undergraduate and graduate and postgraduate and professional undergraduate levels. I train them in mainly immunology, but also some virology, and I teach them about vaccines. I teach about everything to do with vaccinology. I've been well recognized. I've held grants. I have published extensively in this area of literature. But somebody wants to go, a good place to go would be PubMed. The PubMed website. It's a publicly run website where you can look up people's publication records. If somebody goes there and types in my name, you can see all the publications I've done and how many of them are focused on immune responses to viruses and vaccines. I was asked to serve, and I have received multiple citations as one of the top reviewers for the Canadian Institutes of Health Research, for their grant review panels, right? When we decide how to spend taxpayer dollars on research in Canada, I have been asked to serve on a number of their panels. I was specifically invited and asked if I would commit to a 3-year term serving on their virology and viral pathogenesis panel, specifically because of my expertise. They needed my expertise to evaluate grants in the area of vaccine development against viral infections. So I have been well recognized as an expert in this area. And just so people understand, my career trajectory pre-COVID was a very high, steep career trajectory. The reality was I was considered a research superstar at the University of Guelph. I had brought in research funding that the university had never received in their history. They were super proud of this. My career trajectory actually steepened at the beginning of the declared pandemic. I was recognized as a national expert when it came to vaccines. I had been awarded very difficult to obtain funding to develop COVID-19 vaccines, right? So my career trajectory actually did this.
Yeah.
And then my concerns started to emerge about COVID-19 vaccines. And my research trajectory went from this to this to this. And I can't emphasize enough, I have not, as a result of my colleagues losing their minds because of emotional triggering when simply stating the truth, demonstrable truths. Like I said about the biodistribution, we all know that's fact. Remarkably, what triggered them was an interview where I was asked if there was the possibility of a connection between the modified RNA shots and myocarditis. And I didn't even say definitively that there was. I was a researcher. I was recognizing we were in the early days of seeing data. What I stated was there might be that. Yes, I think there's a potential for there to be a link. And hey, did I nail it or what? And then I also expressed that if we are getting this spike protein distributed throughout the body, I was looking at we were studying how the virus was causing severe disease in people. And you know what? It was one component of the virus that was causing most of the problems with severe COVID-19 that was resulting in death in some people. And you know what that component was? It was the spike protein. And so I recognize that if we are systemically distributing the spike protein throughout the body, that spike protein had at that time multiple known mechanisms of harm. should it start getting distributed throughout the body. Why was I so concerned about the systemic biodistribution? Because what happens with severe COVID is it would go deep into the lungs and people would get pneumonia. And the reason why pneumonia is much more dangerous than an infection in the upper airways like bronchitis or rhinitis when it's in the nasal passages is because once you have a virus go deep into the lungs, you're getting into the alveolar spaces. And to facilitate gas exchange, right, removal of carbon dioxide and introduction of oxygen into the body, you have the ever so tiniest physical barrier between that alveolar space and the blood. And so the danger is that the virus starts getting to the blood, and that causes a condition we call viremia, where the virus starts getting distributed systemically throughout the body. And what was causing problems, including problems with natural infection, where people were getting neurological issues, for example, was in particular when pieces of the virus were getting into circulation, and that was the spike protein and even subunits or pieces of the spike protein. So I was readily able to put these things together, right, and nailed all this science. So I want people to understand that my career was on this trajectory. Yes, I will happily share my CV with whoever wants it. I've got, I don't know what it is, 112-page CV. You can see how many graduate students I've trained, how many talks I've given, all the grants that I've held. You know, I held multiple grants at any given point in time. I had a large, very productive research team. I was considered a superstar on the rise in the scientific community. And now, as a result of speaking the truth about COVID-19, my career has been destroyed. I have not been allowed, as a research intensive faculty member, get this, I have not been allowed to access my laboratory or my office for almost 3 years now, as we speak. In fact, I'm speaking from my home office. I would normally be doing this from my university office, so there'd be a little more professionalism, right? I have been stuck in this office in the basement of my house for 3 years now. And as a result, I have not been able to recruit new graduate students because I can't bring on graduate students and say, oh, I'm a research intensive faculty member. I'm going to train you how to be an excellent world leading researcher, but I'm never going to be present. I'm never going to be there in person with you. So I can't. My research program has been completely and utterly obliterated because of this. That's what happened. So and also in recognition of my expertise, you know what? Legacy media was seeking my opinion because they recognized early on there were lots of questions, and early on when they had legitimate questions and they were truly open to hearing what the real answers were, I was being interviewed. Like there's a demonstration right there. People go back. You'll see I was interviewed on shows like the West Block, W5, CTV National News. I was well recognized. I was being asked to write lay articles. I was being asked to give all kinds of interviews because I was recognized as a national, expert, a leading expert in Canada. So yes, I know exactly what I'm talking about, and I will defend my credentials alongside anybody in this country.
I have to point this out quick. It doesn't sound to me like you're an anti-vaxxer.
The most amazing thing is I just recently taught my students, professional undergraduate students about vaccinology. Yeah, and it became very obvious to them. I mean, I'm teaching about how vaccines work. So interestingly, this definition I told you about, that's one of the things I teach, right? So they understand, here's what an ideal vaccine looks like. And then I talk to them about a wide variety of vaccines, and we place them into that context, right? And they can see, so inherently, like, for example, I use the example of vaccines for travel. That's a good example because a lot of people intuitively understand this. And when you understand that, again, you can understand how far away these COVID-19 shots are. Yeah, I'm anything, even though I've had so many people label me as an anti-vaxxer. The remarkable thing is, to this day, I keep publishing articles. I'm recognized in the international scientific community as a vaccinologist. I continue to publish peer-reviewed scientific papers about vaccines to this very day. And yet to this very day, I still have these people who defame me, labeling me as an expert vaccinologist and an anti-vaxxer. Yet I'm teaching my students, and I'm teaching them, think about a vaccine for travel. And anybody, just inherently think about this.
Yeah.
How different the messaging is compared to these COVID-19 vaccines. That tells you how different they are.
Yeah.
because what you do is you walk in and you say to your physician, you know what, I'm going away to this exotic country. And the physician looks it up and says, oh, in this exotic country, oh, you know what? There's a couple concerns here. There's a couple of potentially severe pathogens that are endemic in that country, which means they exist in that country, but they don't exist in Canada. To protect you, and also to protect Canadians, I recommend that you take this vaccine against this exotic pathogen. And guess what? When that person takes the vaccine, does the physician then turn around and say, okay, now you can only be around other people who have got this same vaccine?
That's right.
I mean, holy smokes, because this vaccine doesn't work unless you're around other people who've had this exact
Don't be
vaccine.
around other mosquitoes that have the same vaccine.
Yeah,
no,
that's right.
And also, you can still get it and transmit it. So
yeah. But I think for the travel ones, that's where it's different, because what they tell you for travel is go to the place of danger, go to the endemic region, go to where that pathogen exists, happily go. And the person, what do? They spend thousands of dollars, maybe tens of thousands of dollars to go on a vacation to that place, and they don't worry about coming into contact with that virus because they're protected. And then guess what? The physician also doesn't say to them, don't come back to Canada, or when you come back to Canada, go into a quarantine hotel and don't come to me unless you're masked and, you tell me, and maybe I'll just see you online. They happily invite them back to their office, and the physician asks them, how was your vacation? Why? Because they know that they're not going to get that virus from that person. They know the person isn't going to go and get it when they go to that country, and they know that they're not going to get it when they come here. Why? Because it comes close to meeting the definition of an ideal vaccine. Now, I said, and I see my students are very intuitive, right? So with these students, a lot of them had got the rabies vaccine. So I talk about the same thing with rabies. That can be very dangerous, acutely deadly. And I can go and I can work with animal carcasses, and I don't worry about getting rabies or whether or not they had rabies, because I'm not going to get rabies, and nobody worries at all about me walking out of that post-mortem room and engaging them in a conversation, because they know they're not going to get rabies from me, right? And it's interesting. So I told the students, that is a fairly ideal vaccine. I had a student put her hand up, right? And Dr. Bridle, but do remember, that's actually a 3-dose regimen, not a 1-dose regimen. So it's not an ideal vaccine, right? To which I said, that's awesome. You see, you understand. Right. And you say that. So you'll note that's why I said it's a close to ideal, right? Or an almost ideal vaccine, because you've nailed it. Because the definition of an ideal is 1 dose. So you see, Kerry and Chris, I think people can see I get very passionate about vaccines. I love vaccines. But what I will tell you, what the last 4 years has shown me is this. I have changed how I teach vaccinology now. I just teach it generically. I teach the facts. I teach what an ideal vaccine looks like. I teach how good vaccines should perform. I teach what the research should look like for people to be able to place their trust in vaccines. I'll be honest, I used to use some of Big Pharma's vaccines as examples, right? And give specific examples and even promote some of them. I will never do that again, because I have lost all faith in how Big Pharma practices vaccinology. I'll tell you, anybody who works on my research team, they will tell you, I do not publish anything about with my vaccine research unless I'm 100% confident in the quality of the data, and we look intensively at safety issues. Even with the vaccines that we develop, we're not afraid. And I have taken vaccines that I've been developing and I have thrown them out. And I have stopped doing that research because I'm not convinced that they're safe enough to continue. That includes, remember, I mentioned I got funding for COVID-19 vaccines. My group made a bunch of COVID-19 vaccines, a bunch of them, and I have not pursued that research. At the time, I remember people are, conflict of interest. The reason why he's raising concerns is because he wants his to get the front line. People didn't realize I only had funding for the preclinical phase. You need millions of dollars of funding to get into human clinical trials. They never had a chance of competing with these. And now I can prove to people I put those on a shelf and I walked away from it, and I never renewed my funding because I followed through on my concerns. My concerns were genuine. And now people can see that they were genuine. But that's how I am. And that's how I am with my research team. So I will always defend, I will rigorously defend what I call the elegant concept of an ideal vaccine. But I will never again stand up and defend Big Pharma's products. They have screwed up this field. And what I want to make very clear, Kerry and Chris, right? I appreciate you giving individuals like myself an opportunity to be able to get our message out where others don't. the very reason why I spoke up with my concerns early on was because I recognized that if this was screwed up, the entire field of vaccinology would be permanently harmed. Now, guess what? Now we have the Health Canada, the Public Health Agency of Canada, all these, misinformation gurus, they're all going public now, and they're starting to get, they're all flustered because they're asking this question: why is there all this vaccine hesitancy? Why is this growing? Why is there this explosion in vaccine hesitancy?
Right.
You notice how with this event in Vancouver, they're trying to confound that with the measles vaccine. Meanwhile, we're focused on the COVID-19 one. Well, let me tell you, the reason I will tell people why vaccine hesitancy has exploded, it's because of those very people. It's because they silenced people like me who were speaking the truth. And they put forward a narrative that was incorrect, that was demonstrably false. So I say to everybody, I'm a vaccinologist. I love vaccines. And I also say to everybody now, if you're vaccine hesitant, you deserve to be, you should be. The onus, I say now, is on these big pharma companies, on Health Canada, the Public Health Agency of Canada, all the people, the infrastructure that pushed these shots and didn't disclose to people that these were far from ideal. The onus is on them now to earn our trust back. And that gets back to what we were talking about. They have to be able to demonstrate to the public that they are actively, critically evaluating these technologies, demanding proper safety studies, demanding fulsome safety studies, demanding long-term safety studies, etc., and showing that they really are truly effective, such that people can with confidence look at it and make their own personal cost-benefit analysis. That's why I spoke up, was to protect my very field. And these people who attack me and accuse me have successfully destroyed my field of vaccinology, right? I'm now left to try and pick up the pieces.
Yeah.
While these other people just, I don't, because remember, a lot of the people who push this, they're not vaccinologists. They're not real subject matter experts. They haven't destroyed their field. We have all these pretenders who stepped into the field, who claimed they had greater expertise than people like me. They've destroyed my field. Now they get to go and happily work in their field, while mine is a complete and utter mess.
Yeah, you're right. So we acknowledge that there's vaccine hesitancy, right? And the idea behind this particular podcast, and it's the $1 million question: are vaccines safe for kids?
So, what I say, I again, so I'm not going to trash all historical vaccines. Absolutely. I will tell you that I have started, and I haven't found sufficient time to do this with nearly enough, but I've started to go back and I've started to look at some of the historical, because COVID woke me up to tricks that they're being played actively by big pharma companies. Yeah. And I'm seeing that they're not being properly, objectively regulated. And so I have started to go back, and what I will say is this: I have concerns emerging about some of our historical vaccines that I didn't have before because I never bothered. Again, I just trusted that the research was done properly. I tend to be a preclinical research, so I tend not to focus as much on all of the clinical data. I'll look on the clinical trial data site. I'll see how experiments were set up, how they were supposed to be run. But okay, so let me give you an example, Kerry and Chris, of one of the things that shocked me. Okay, I have to admit. So one of the vaccines that I talked about, which I don't now, but I historically always talked about with my students, was the HPV vaccine. The vaccine they want to give, young girls and guys, at around 12 years old, give or take a few years, against the human papilloma virus, right? Which in some people, in some cases, can cause cancers. Mm-hmm. The vaccine targets only certain subsets of the human papilloma virus that causes these, by the way, not all of them. Plus, the reality is, and I've always recognized this, the cancers that do develop in people from human papilloma virus can often be identified early and can be very treatable. All right, so keep that in mind. And the other thing I always feel compelled to tell people is there's a very easy way to make sure that a person is at zero risk of getting that, and that is if you are not sexually promiscuous, you're at zero risk. So there's lifestyle choices people can make to completely protect themselves. Mm-hmm. But this is the thing. I blindly, highlighted that as a great vaccine. And you know what? I went back and started looking at this, and this is what bugs me. I checked. There's a website that I often check. It's called clinicaltrials.gov. It's a site run by the U.S. government, and most people running clinical trials want to get them approved in the U.S. because that's the big market. And so I go there, and I often look at what the clinical trial design was, right? And I looked at it for the human papillomavirus, and I thought, this looks like a very appropriate design. So why would I have concerns? And you know what? Specifically, what I look for doesn't seem like a proper experimental setup. So if you're wanting to evaluate safety, in other words, they had a group and they said they got the HPV vaccine. And then they had a group and they explicitly stated they received a placebo. So what placebo means in science is it's either a saltwater solution or it's a sugar water solution, but it has no bioactivity whatsoever. So it's a perfectly appropriate solution to give for a control group to evaluate safety. And so so when I was promoting this, that is what I had seen. I'd done my research and I had saw, they did safety testing. It's an appropriate setup. You know what I learned? Because I didn't then follow up with publications that came out later on, is for clinical trial participants, they actually went so far as to not even say a placebo, but on the consent forms that people signed off on, they explicitly stated saline, which means saltwater solution, which is important because otherwise they could maybe say, oh, well, what we ended up using, we meant to, we define that as a placebo. No. So I saw that on the consent forms, they explicitly stated saline. So that is absolutely what a control group should get. You know what I found out when I went back and did this research, and again, the papers are published, they're out there, and it shocked me to the core, and it's why I will not sell the HPV vaccine on behalf of these companies ever again. I found out that they actually gave the control group what's called the adjuvant. And just so you understand, remember I mentioned, the government was wanting to reassure all of us about this new technology that functions like a traditional vaccine technology. Well, traditional vaccine technology, what you would typically do is you would take the pathogen or pieces of the pathogen, and often you would mix it with what's called an adjuvant. So especially if you're using pieces of the pathogen, because what happens is, a vaccine has to do two things. It has to show the immune system a target. So that would be the piece or pieces of the pathogen, right? For the COVID shots, that's spike protein. So you have to show the target, but the immune system is not going to respond to that target unless it thinks it's dangerous. The adjuvant is the bioactive component of a traditional vaccine that causes the immune system, it triggers inflammation and things, and it tells the immune system, this target that you're seeing is dangerous. So you should respond to it. So you know what I learned is that in the actual experimental setup, to my shock, for the HPV vaccine was they gave the treated group the vaccine, which is the bioactive adjuvant, plus what should be, ideally, unlike the spike protein from SARS-CoV-2, if you're picking an appropriate target, you're picking one that's not bioactive in the body, right? So they're taking the non-bioactive piece of the virus, the target, mixed with the bioactive adjuvant, and then for the control group, they're injecting them with the bioactive adjuvant, minus the non-bioactive protein. Proteins that I can't tell you. If I conducted my research as a preclinical vaccinologist that way, I would never be able to publish. Or immediately the reviewers would come back and say, this is a fatal design, and this is a fatal experimental design. And I would never be able to publish this stuff. And I'm seeing this, and I was shocked because how can you compare the safety of the bioactivity of a vaccine when you have both groups getting the bioactive component? You can't. So what I'll say this, Kerry and Chris, I have not been able to go back and look. I mean, there's a huge array of vaccines there. I do intend, as I have time, to go back and look. But what I will say is I'm not going to bash all vaccines. I'm not going to bash all vaccines on the childhood schedule. I do think it's great, especially in this day and age, especially with the experience we now have, especially with the legitimate questions I now see arising from historical vaccines. I think we need to be much more open to letting parents make their own informed decisions. That's one of the things I believe. And I believe that because Big Pharma and our health regulators have screwed up with the COVID-19 shot so badly, the onus is on them as well to reinstill our faith in older traditional vaccines. Maybe they should go back and they should start looking and seeing, do we really have solid safety data? And where we don't, maybe we should go back and make these companies go back and do what they should have done at that time, which is run proper safety studies so we can be very transparent with the public about this. They need to do that. The onus is on them. And so when I see people like your Timothy Caulfield and your legacy media saying, oh, well, you know, they're trying to link us to the measles vaccine with this event, right? Oh, look, we saw a child who was unvaccinated that died. My goodness, yes, that's awful and everything else. But you know what? If you want people to take those vaccines, then now you got to convince them that the same screw ups that happened with the COVID-19 shots didn't happen with those. And I, as a researcher, cannot, in the absence of going back and doing the very detailed analysis, it'd be very time consuming because it's a massive amount of scientific literature spread all over the place over a long period of time. So the onus is not on me. Like I said, the onus is on these regulators now to convince parents, you know what, the safety data is really rock solid. With open discussions about this. And I would say, you know, let's bring those to the table. So I'm happy. I don't have the time to go back and do it. So I would say, but I'm happy if somebody wants me to sit in, bring me into their meeting when they're discussing one of these vaccines. And I will look at, so if they can bring all the data to me, you know, so it's all done. So I don't have to go and try and search the globe for the data over a long period of time. They put it in front of me. I'll look at it and I will give my opinion as to whether I think it's rock solid or not. That's what I'll do. I'm not going to bash it because you know, I don't say anything good or bad about anything unless I've got rock solid scientific data to back it up, because I don't want it ever to be about what Byram said. I want it to be, all I do is I just try and make the complex science accessible to lay people. That's it. So you know so that's where I stand, Kerry and Chris. So I'm not going to bash it, but I'm also not going to rigorously defend it. And like I said, I have concerns about historical vaccines that I did not have before.
So even for now, should we talk to our government and tell them, the health authority, we would like to have a pause on any COVID-19 injections for children?
Okay, this is my take. And again, if people are wondering, I can be far more, I can talk hours about my concerns, but let me just highlight a couple. We already talked about the known toxicities of the lipid nanoparticles. That I wouldn't be so concerned if we stopped at 1 or 2 doses. That is not how it is for these. That is a legitimate, serious safety concern. Then there's the spike protein. We now know there are about 20, known potential toxicities of that protein, at least in the scientific literature now. Remarkably, do you know what the most recent one is that we learned? This was just published. So because we keep learning more. So it was just discovered that the spike protein can bind to the estrogen receptor. This is very important. And so people, this is actually very fascinating. You might be interested in this. It existed as a preprint article. It's now been published in a peer-reviewed scientific journal. The authors showed very clearly that the spike protein can bind to the estrogen receptor, and this can contribute to the development, potentially to contribute to the development of breast cancers in particular, was one of the cancers they were very concerned about. All right, so in women, this thing can bind to the estrogen receptor and disrupt estrogen receptor signaling. This is very important to the basic physiology of women. So this is very important. Now, what's interesting with that is, and I've seen this so many times in the literature, I'm going to do a Substack article about this because it's absolutely amazing to see this censorship happen in front of your eyes. Those authors in the preprint article, they have a concluding paragraph. It's remarkable. And then in the paper that got published, it's the exact same concluding paragraph, except the last sentence was removed. Because what it is they talk about how this could potentially be an issue with natural infection. But again, when it comes to natural infection, remember, we're not talking natural infection in the lungs, which is what this virus does, especially now, these variants. And most people, it's just the upper airways, that's it. We're talking about when it gets systemic and you start getting the spike protein binding to the estrogen receptor throughout the body. So let's remember that. But what they do, of course, is they link it to the potential for natural infection, but we're talking about severe disease. So somebody recovered from severe disease might have this as an issue. But of course, the authors recognize it's the same spike protein that's getting systemically distributed throughout the body with these shots, right? And so they state this also has to be taken into consideration when it comes to the vaccines as a potential issue. The editor made them remove that sentence about the vaccines so that it seems like it's only a concern with natural infection. All right. But so I kid you not, we have at least 20 known potential mechanisms of harm should the spike protein get distributed throughout the body. So that is an all stop for me. We now have this DNA contamination, and we could talk for hours about that as well. But that was never supposed to be there. That was because they switched the way they manufactured that, and that was not disclosed to anybody. They used a very clean production method for the clinical trials, but that method could not generate enough doses of the vaccines for a global immunization program. So they quietly switched and got bacteria to be the workhorses to manufacture these modified RNAs, these little genetic blueprints they packaged into those fat bubbles. And this is the problem, not properly understanding this novel technology. Usually it's very easy to get rid of that bacterial DNA, but not when you have synthetic RNA present, as we have learned. And so as a consequence, these doses are, and what we found so far with the research in Canada, every batch of vaccines for Moderna and Pfizer that have been evaluated are badly contaminated. So there's that aspect. So those are 3 examples which make it an all stop for me. But let me just give you an example, because it's not just that. It's not just the known harms. This is what's very important. Let me use the DNA contamination as example here. Again, I have caught Health Canada lying over and over and over again. I first saw it when it came to biodistribution data, where I saw, what? You guys told the public an outright lie. And you know what? When it comes to DNA contamination, they're lying again. So if people don't understand, we have freedom of information requests. People need to see this talk that Dr. David Speaker is going to give in Alberta. He has the freedom of information, requests and the communiques from Health Canada, where they say that there's a sequence in that contaminating DNA. They openly admit that it's a bioactive sequence. They have to. We know it's a bioactive sequence. But then they went public and said, oh, yeah, it's there, but you don't have to worry. It's not a bioactive sequence. We have the communication where they admitted it's a bioactive sequence. They have lied to the public about that. Here's another place where they've lied about the DNA contamination. They keep telling people, oh, yeah, we have to admit now, we never did the studies. We never had anybody look at it. We trusted the company look at doing their own quality control. This was accidentally discovered by Kevin McKern in the United States. Otherwise, we wouldn't know. But now we have to admit, yes, it's there. But Canadians, we want you to understand it's below the cutoff, the safe cutoff. We have an established cutoff for DNA contamination. It's below that. 2 lies there. A, with some of the batches, no matter what method you use, they are above that threshold. So there are batches where no matter how you try and argue it, they are excessively contaminated, period. All right. And now this is the most egregious part, because what they are not revealing to Canadians, they keep telling Canadians this is below the safe, what we've determined to be the safe threshold. Do you know how that safe threshold for DNA contamination was established, Chris and Kerry? It was based on naked DNA. Naked DNA is like naked RNA. It is exceptionally difficult to get naked DNA inside of cells. That's where it's dangerous, is if it gets inside of cells. So those cutoffs for contamination is based on naked DNA. Do you know how you get cells to efficiently take up DNA? You associate them with lipid nanoparticles. And then the uptake by cells is increased by orders of magnitude. In other words, what they are not disclosing to the public is we need those safety cutoffs they're declaring are completely irrelevant. They're comparing apples and oranges. It's based on naked DNA, not lipid nanoparticle associated DNA. We have to go back and we have to establish new safety cutoffs using lipid nanoparticle associated DNA. And I will 100% guarantee that those cutoffs will be substantially lower when you do that same, when you establish that same cutoff and do those same safety studies with lipid nanoparticle associated DNA. So let me just summarize again. So there's things like the DNA contamination. There's things like the systemic biodistribution that we talked about. There's the fact that the lipid nanoparticles are toxic if you multi-dose with them. And then there's the outright lying The fact that we have not been able to trust, we can't trust a regulatory agency. So for all those reasons, I'll get right now to the simple chase. Not only do I not recommend these for any children, I don't recommend them for anybody. And we need to have a worldwide moratorium on this technology until we figure out things as basic as how can we manufacture these things properly such that they are not grossly contaminated with things that should not be present in those vials.
But
wow,
somebody might get COVID.
Oh yeah, and on that front, okay.
Yeah.
At this point, this is why I can't even I believe why Alberta Health Services would put this as a recommended vaccine on the childhood schedule. Yeah. I would be surprised if there's a human being left on the face of this earth that has not been exposed to SARS coronavirus 2 at least once, and most of us many times, and especially when we get to children. So again, as you already mentioned, in the worst of it, when we go back to the more dangerous variants early on, which weren't nearly as dangerous as they were publicized. Yeah. But there, as you said, even in that scenario, COVID was statistically, like you said, statistically, children were at a 0% risk, statistically 0%. So it wasn't absolute zero, but statistically you couldn't differentiate it from zero. That's the reality. And of the children that were at risk, they were children that had known high risk factors like obesity, so some of the children, so a very limited number of children died, for example, but they were children, for example, they were morbidly obese, they had end-stage leukemia, their immune systems were completely shot, they were at risk of dying from any infectious disease. We had children with multiple
Alberta had a brain tumor.
Yeah, that's exactly. Right. So I have not, I've not been able to see the data. For a while, I was able to keep up with the newspaper articles. I was able to actually track down, in many cases, the cause of death for children. And again, when it was linked to COVID, and then I ended up seeing, but this child had fatal leukemia, right? They were in end stages of leukemia, for example. It's like, well, okay, so, of course. So to put it this way, I have not seen any substantial evidence that there are any large numbers of children who are perfectly healthy that died with COVID. And this is the thing. And regardless, we're talking now, especially now, this virus has changed. It no longer has a tendency to migrate deep into the lungs and cause that pneumonia and potentially get systemic. It's an upper respiratory tract infection. There is no question that it is. So for children, it is substantially less dangerous than the flu. Right. And we don't run around in abject fear about the flu. And we don't coerce anybody into getting those shots, and we don't mandate them and force people to get those. They're not, the most effective shots for various reasons. So the whole point is people don't need this. OK, it's for the vast majority of people now. This is like all the other cold and flu-like ailments that we experience on an annual basis. It has become endemic. It was endemic a long time ago. In fact, by using these COVID-19 shots, we pretty much guaranteed driving this into a situation where it's now an endemic pathogen. Why? Because the only way that you can get one of these extinct is if you can actually generate immunity in people. So if you can generate herd immunity, then you have a chance of getting rid of the virus. But this is the point. It's not rocket science. If you think about it for a moment, if you were to achieve herd immunity, you have to, by definition, be able to achieve individual immunity, because you can't have a herd that is immune if none of the individuals are immune, right? And what I mean by immune has a very specific meaning. Again, immune means you don't get the disease and you can't transmit the causative agent. And I will tell you guys, the classic recipe for driving the emergence of what we call immunoevasive variants that can escape the immune system, is this. You can look to cancer therapy, where people get chemo-resistant cancers that regrow, and radiation-resistant tumors that regrow. And you can look at antibiotics, where you get antibiotic-resistant bacteria. It's always the same. There's a very basic fundamental equation here. If you have a biological entity, like a cancer, like a bacterium, and like a virus, like SARS coronavirus 2, and so it's prone to mutation, naturally and inherently mutates, and then you apply a non-lethal selective pressure to it, that's the recipe for driving the emergence of variants. So using the subpar shots almost guaranteed that probably accelerated the emergence of these variants and guaranteed that this would become endemic. That's what we did. And so again, I say we can't ignore. So when you say people might be concerned, well, what about COVID? If I don't get the shots, natural immunity, it works. You know what? Our immune systems, as much as it was ignored, completely ignored. And the literature, I will tell you, I will stand up anywhere. And I now have 130 peer-reviewed scientific references that I'm happy to show anybody who will try and contend that naturally acquired immunity is not valid. And I will tell you this, naturally acquired immunity against SARS coronavirus 2 is superior in every way, shape, and form. Yeah. As compared to these very subpar immune responses that get induced by these shots. People, don't be fooled. You say, oh, but they show the data. They show these great antibody responses. Yeah, you know what? They showed antibody responses in the blood, an irrelevant anatomical location. Wake up, people. The virus infects the respiratory tract, not the blood. It does not appear in the blood. It infects your respiratory tract. Naturally acquired immunity, you're getting naturally vaccinated by being exposed to the virus in the respiratory tract. One of the ways, you know what was amazing, that they tried to trick people into thinking that naturally acquired immunity wasn't as good, is they said, oh, look, some of these people that recovered from natural infection don't have antibody responses that are as robust as what we can get with these vaccines, with these shots. First of all, a natural response against the virus you mount a relatively weak antibody response because they're best used against extracellular pathogens. These antibodies can't get inside cells, and guess what? The viruses live inside cells. So we produce smaller quantities, but they are ideal types of antibodies for neutralizing that virus for the short time it is outside of a cell. And guess what? So, of course, they're showing in the blood, somebody who's been naturally infected in the lungs has relatively weak responses in the blood. First of all, those are perfectly adequate for protecting against serious disease, should somebody get pneumonia and it get into the blood. Secondly, what they didn't show anybody is that with the naturally acquired immune response, you have a vastly superior immune response in the respiratory tract compared to if you give, because when they give those shots in the shoulder, that's a mistake. That's another design flaw in these vaccines. It tricks the body into thinking there's a systemic infection. But what it does is you get this great response in the blood, but you want the response in the respiratory tract. Yeah. We know this as immunologists. I can guarantee they would have tested these vaccines by delivering them either intranasally or through an aerosol, inhaling them, because that would have been the proper way, the proper place to induce an immune response. I can only guess, because they never were used that way, that they probably proved to be far too toxic there. That would be my prediction. So we know this. And so naturally acquired immunity, and also with a natural response, you're responding against all the components of the virus. Whereas with these shots, they only confer subpar immune responses against one component in an anatomically irrelevant location. And so even as variants emerge, people of naturally acquired immunity will be better protected than those who have received those shots, because the virus is primarily changing. And this fits with what I just said. This hypothesis is if you apply a pressure, where is that pressure being applied with these shots? Only on the spike protein. And guess what's changing in these viruses? Almost exclusively the spike protein. Very little changes happening in the rest of the virus. So when you mount a natural response against all those other proteins, and you have a new variant that comes out, your response against all those other proteins is maintained. And so what will happen, Kerry and Chris, is I can guarantee, will people get infected with SARS coronavirus 2 again? Yeah, they probably will. Just like with the flu, just like with all cold viruses, because it will mutate over time. And if it mutates sufficiently that it can start evading your immune response, you will get reinfected and you will get a mild infection. And you will feel mildly sick for 2 or 3 days, and you will recover. That's going to be the vast majority of people, just like all these other viruses. Now, if you hide away from that virus, if you do what we did and you lock down and you mask and you isolate yourself from this virus for a long period of time, now all of a sudden your immune system is not seeing a slightly immunoevasive variant. You're now being exposed to one that has had a lot more time to mutate. And then you're at risk of more severe disease. It was as simple as that. Remember when we stopped the lockdowns with kids and there was this global concern? Why are these kids getting all these infections? All these infections that used to be mild.
Yeah.
And now they're very severe. There was no mystery to me, Chris and Kerry. When you lock kids away from the world for a year and a half and allow these viruses to continue to mutate and their immune system is not keeping up with it, of course, now their immune systems are way out of date when it comes to these. So that's why I say, as long as for the average person, if you're not a high-risk individual, like for example, if you're immunocompromised, you need to be careful about all infectious diseases, okay? And you need to take special precautions. But for the average person, no. As long as you don't hide away from this, SARS coronavirus 2, every once in a while you'll get infected, and often you'll get infected and you won't even know it because your immune system will be up to date enough. It'll clear it before you get sick and you'll have up-to-date immunity again. So I'm not concerned about that, Kerry. So no, even on that basis, Kerry and Chris, there is no rationale. There's no rationale any which way you slice it for giving these shots to kids. It is excessive risk, and I can't see any net benefit whatsoever. And that's for anybody now at this point, by the way, not just kids.
And I know we've got like almost 40 questions here, Chris. I'm not sure if you want to kind of go through those. We better start.
I have one question for the end.
Yeah. Oh, right at the end? Okay. One of the things, too, is people often talk about long COVID. And do you think long COVID is a byproduct of actually catching COVID, or do you think it's a byproduct of maybe getting a shot and having it work against your body?
Okay.
Kerry, sorry, I got to interrupt for just a moment.
Sure.
Byram, if you don't mind, have a look in the comments. Just catch that name there. This is a immunologist. It might be worth just checking that out and maybe dropping Steve a line to talk about that after.
Yep.
Sorry, go ahead.
Okay. Yeah, I appreciate that. It's great to see a comment from another immunologist. That's awesome. There's been too little discussion between immunologists over the past few years. So sorry, Kerry, what was your?
So it was about long COVID and whether or not it actually caught from.
So the narrative answer is long COVID can only be caused by natural infection.
Yeah.
The reality is, what is the primary cause of long COVID? Again, what is the primary bioactive component of the virus when you get severe, systemic infection? It's the spike protein. So the reality is we cannot differentiate between long COVID caused by natural infection and long COVID caused by the shots. And we need to, as a scientific community, we need to acknowledge that there is massive overlap in the mechanism that drives this, and at the heart of that is the spike protein. And so the real answer is both. Natural infection and the shots can cause long COVID and long COVID-like effects. And the interesting thing is, though, it also means that the solutions have a lot of overlap potentially, right? Because it's the spike protein we want to be targeting, and basically it's the spike protein that we want to deal with and we want to try and get out of the body. And if you look at the physicians who are working on that, that's what they're doing. They have protocols. Interestingly, it's often the same physicians that knew how to treat people with COVID, with the ivermectin and hydroxychloroquine. They're the ones that are also looking to help people now, both those who got the vaccines and those who also got natural infection. And you know what? These protocols tend to work well with both because, again, they're designed to get the spike protein out of the body.
Here's another question from our buddy Phil here. Byram, can you talk about the isolation of COVID-19? I believe your Dr. Hodkinson testified about it at the National Citizens Inquiry. It's one of those distracting arguments that seems to distract from the mRNA harm.
Yeah, so I've got that too. I've got people sort of attack me and say I clearly can't know anything that I'm talking about when it comes to science because I actually believe that viruses exist. So, again, if somebody has a very specific question about viruses, I can answer that. But what I have observed is this seems to have been birthed from a large number of freedom of information requests that people have been put out. And at first I was confused as well because they would send them to the Public Health Agency of Canada, the Government of Canada, and say, prove to us that this virus has been isolated. And they would get back these messages saying, we can't, or we don't have this documentation that you're looking for. So again, I'm happy to look at different requests, freedom of information requests. But when I looked into one of the things that I saw that was a common feature was people were always and the ones that I saw, a consistent feature of this request was being very firm on having this data only be shown in the context of a virus isolate that had never been propagated in a cell line.
Mhm.
And
that's impossible.
Yeah, exactly. If that's what the request is, that's why the agencies are coming back and saying we can't provide you with that, because this hasn't been done in the absence of cell lines. And so I know people then have this hypothesis that it's toxins in the cell lines that are really what are causing the effect, or what we're actually studying. It's not a virus. Again, if people want to get into specific questions about that, I can try and address those. But what I can tell you is we can have the cell line from an infected individual who has the disease, and we can passage. So we can take samples from people and put them in cell lines so people understand the way this works. If we're going to study a virus, you have to have enough of the virus to be able to detect it and work with it, to be able to sequence it, to be able to diagnose it. When we did that, when the PCR test was done, if you have too few viral particles, it won't detect anything. You have to have, for any test, any way to study, or any way to diagnose a viral disease, you need a threshold dose. There's a minimum threshold dose. And so you have to, and so if we're going to do research on this and we're going to study this, you have to amplify the virus. So what happens is, if you go into a tissue and you grab a tissue from an infected person, so let's take it's the nasal pharyngeal swab, right, from an infected person, there's actually not going to be a massive number of viral particles there. And we also can't pick them out from that tissue. So in order to visualize viruses, they're so tiny, the only way we can visualize them is by electron microscopy. If we do electron microscopy, we do nothing with that sample. So let me give you an example. I do cancer research. We could take a cancer biopsy, and we can isolate and study individual cancer cells. So under a regular microscope, I've worked these type of microscopes. Under the microscope, you can see individual cells. And we actually have a laser attached to it. And using software, we can put our mouse pointer on a single cell. And say, I want to study this one cell right here. Yeah. And you know what? We click a button. It's like on a joystick. We click a button. The laser shoots, and it actually picks up that cell. It actually it charges that cell, and using charge, we're able to isolate that single cell from the biopsy. Then we can study it. So we can then go and say, I want to study this cell, and I want to study that cell and that cell. We can't do that with viruses. So you have a nasal pharyngeal swab. There's no microscope where we can sit down and look at it and say, I see 5 viral particles here. I'm going to pick this one, this one, this one. I get the 5 viral particles. Well, first of all, I can tell you, even if we could do that, 5 viral particles is not enough to do research. That's not enough to get sequence material on. That's not enough to even see if it recapitulates the disease. You need far more, a much higher dose. So we would have to get so many of these nasal pharyngeal swabs, for example, and keep picking the virus and piling them up until we have enough to work with. The other thing is, many of the viral particles are defective viral particles. They aren't functional. They're not what we call replication competent variants. The replication competent variants are actually rare. That's one of the problems with the PCR testing that was done. Is most of the genetic material that we're identifying is actually coming from defective viral particles, not ones that have the potential to cause disease. So that is why we have to use cell lines. So these cell lines, what they are, there's nothing special about them except they're stripped of all their antiviral protective mechanisms. All of our cells naturally have very potent antiviral defense mechanisms. So these are cells that are stripped of that. So even if you only have a few viral particles present that can potentially replicate, when they're put on these cells, the cells can't defend themselves. So the virus gets into the cells. It might even be one viral particle gets into one cell, and then it replicates, and it bursts out from that cell, and it gets into the adjacent cells, and it spreads like wildfire. So in these cell lines, what you do is you look under a microscope, and you see all these perfectly healthy cells. They're like a lawn on the bottom of the cell culture dish. And beautifully healthy. and then we add the tissue. And then we can look 24 hours, 36 hours later, we look under the microscope, and if all those cells are dead, that's because a virus has run rampant through there. And then what we do is we take what we call the supernatant or liquid portion of that, and that contains the viral particles. And then we can purify that and we can study it. And now we have it in very large quantities so that we can sequence it and do all these other things. Now, so that's all I can explain to you is that's the standard practice in virology. And so that's why if you do a Freedom of Information request and say, prove to me that you isolated this virus in the absence of cell culture, of course they're going to come back and say, we don't have that, because that's not what's done. And just so people understand, for these requests, they don't even come back with those explanations. The way it works is you either you have to be very careful how you word these things, because they take every word literally. And so if they do not have information that matches every requirement that you have stated there, they simply come back and say, no, we don't have that information, So that's one of the misleading things. And then when it comes, again, it's hard for me to say if I don't have somebody who's actively trying to challenge me on this. But when it comes to the cell culture, what I can say is we've added that sample to that cell culture. We can take a healthy person and do a nasopharyngeal swab and add that to the same cell culture beside it in another culture dish. And we do not get that cytopathic effect. We do not get that killing of the cells, and we do not get particles that we then can isolate from the liquid portion. And we don't get anything that can recapitulate the disease. But when we get this virus from the cell culture, we can recapitulate COVID in our animal models, etc. Right? So we can meet Cook's postulates with this. So again, I'm trying to envision where some of the arguments have been, but what I say, so there's, I think, a very fulsome explanation.
Yeah.
And if somebody has more, specific things, I'm happy to address that.
Okay.
So actually, I just saw a comment. If I could just say one thing, Chris, because I know somebody just put in, this guy is not a medical doctor. That's a classical type of trolling thing. They may have joined late and missed when I was commenting on the fact that in the medical, I would train the equivalent. I actually train veterinary students, but I've also trained students who go on to become medical doctors. And I already gave you the example of when I was at McMaster University that these people get minimal superficial training in virology and immunology. So that's a classic thing that we get in court cases, and that mainstream media would kind of say is exactly that. Well, I'm not a medical doctor. Exactly. That's why I know what I'm talking about. Again, with all due respect, it's why I know what I'm talking about, because I'm a subject matter in virology and immunology, and the average medical doctor is not.
Well, you know what? If Lisa thinks that your information isn't valid, she could always challenge you on what you're saying. So I'm sure she has a very
Lisa, pose me a question and see if I know what I'm talking about. I agree.
So I'm going to put a little bow on your explanation of that question about isolating the virus. So I watched that question circulate around the internet and be used as a smoking gun to try and say that COVID didn't exist and we shouldn't be locked down and blah, 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 blah. Well, I was aware of someone who tried to use that in court. I got the transcript the day after, and it happened exactly the way you kind of described, Dr. Bridle. The question that was asked is referred to in court as a strained or a stressed question or something like that. It's a question that doesn't have an answer or doesn't have an appropriate answer, can't be answered. So the thing was, you can't answer this question, so that means COVID doesn't exist. No, it was simply a bad question, and it was really frustrating for me to watch. There was in the United States, there was a one of those drama-seeking kind of right-leaning news outlets ran this story that COVID was ended because this question couldn't be answered. And I was like, it was a facepalm event the entire time. So, yeah. And if you're going to say the virus doesn't exist, so none of this is real, well then, Dr. Bridle, you have to discount what he's saying, Dr. Roger Hodgkinson, Paul Alexander, all of these amazing men and women who stood up and spoke the truth about these things. If you're going to say, oh, the virus doesn't exist, well, you're basically saying that none of them know what they're talking about, and why bother anyway? So, it's not. That's my take on it.
Yeah, I appreciate that. I didn't hear about the court case, but it doesn't surprise me at all. And let me just say, if people want to take that time, look, people are welcome to their own personal opinions, right, on things. But if you're going to want to try and take that tact, that's a recipe for complete and utter. Well, you're never going to have success. You're never going to have a success affecting change with what we were just talking about, with how the medical system operates right now, with how health regulatory agencies work. There's not going to be any success in court cases at all. I won't touch that with a 10-foot pole. If you're going to pursue that, just understand that you're going to ultimately help no one. It's not going to be acceptable.
So if we're going to solve a problem, we have to focus on the real, actual, tangible problem, and we have to pursue tangible solutions.
Yeah, look, Chris, I have worked with other experts, and I've worked with other experts where we've openly acknowledged, they don't believe viruses exist. And they knew that I and other experts did. But you know what? And we strategic, but they also knew, they accepted that was not going to be an easy to defend position, even though they felt that they could defend it in front of courts, in front of all of these scientists around the world who were claiming there was a medical consensus. I mean, if you just throw out the entire field of virology, you're in big trouble. And so I actually have worked with experts where, we decided, you have the right to think what you want. I have the right to think what I want. And the lawyers listened to us, and the advice we ultimately came to, and the advice that people like myself gave is, why don't we stay away from the virus thing? Because that's going to be low-hanging fruit to destroy this, to destroy your case, right? Mm-hmm. And why don't we focus on what we do all agree on? There's many things. If you're concerned about harms to children from the COVID shots, there are so many things, so many concerns that, we can set aside one or two, and there's still a truckload to justify not using these things. So why perseverate on something that is going to be harmful to the community, right? There's lots of common ground for us to focus on.
Yeah. That's a very good point. And if you do believe contrary to that, then back it up with evidence and present it, and see if you can reach a consensus with other experts and go with that. But in this case, there's an easier way to do this. Go ahead, Kerry. Sorry.
All I was going to say is my laptop's going to die. But first of all, if it does die, I just wanted to say thank you so much, Dr. Bridle, for doing everything that you do and getting the attention and the education out there so that people can ask educated questions. And the questions that are coming in the comments are all amazing. And I'm going to do just a bunch of rapid fire ones, and you can just answer yes or no's. We don't have to go into the whole gamut of things, but I just wanted to at least get through some of these questions. So Cass asked, Dr. Geet, Van der Bosch thinks the final mutation of the virus has increased transmissibility of the virus inside the host. Basically, the question is, so what do you think? Is the COVID pandemic over?
So the
yes
virus,
or no?
It's hard for a scientist to do, but I'll be quick.
Yeah,
viruses typically take the course of action that SARS coronavirus 2 has been taking, which is they get more transmissible but less dangerous as time goes on. At the extreme, you have something like Ebola virus. Ebola virus, the reason why we don't have these huge global worldwide pandemics with Ebola virus is it's so deadly, so dangerous, it burns itself out, it renders itself extinct in a population. So viruses typically take that tract. I've looked at what Geert Van den Bosch, has stated and his concerns, and that there could be a sudden turn for the worse, especially in people who have received the shots because of how their immune systems have been altered. Do I agree that there's that theoretical potential? Yes. Based on natural virological history, do I think that's a substantial concern? For me, no. But I do agree he's got a legitimate theoretical concern there. But the other thing I always like to point out as well is all the evidence points towards the fact that this is not a natural virus, right? Mm-hmm. That it came from gain of function research. In other words, so what I just said about looking at sort of the natural history of viruses, that might not apply to a virus that is not natural. So what I will say is, theoretically, he has a point. It's a possibility. I'm not overly concerned about that being a major issue.
Okay. Tim asks, do you know of any labs doing single cell or spatial histological? Sorry, I'm
histological work.
Thank you. I'm a little sweaty in my van here. Work to check for pDNA integration events. I work for a 10 times genomics. Oh, where we supplied to do it. If only there were interest. I gotta roll down my window. I'm sweating.
You know, yeah. So this is a great question that Tim had. And what I can tell you is, I sort of have this international network of colleagues that I love, right? My network of colleagues looks so different than it did several years ago, but I wouldn't trade it now for the world. It's awesome. So what I can tell you, Tim, is yes, there are people who are actively looking for this. So what I can tell you is there's recent research that did show the potential for integration. And so people understand this pDNA, that's the plasmid DNA. That's this contaminating bacterial DNA that we were talking about. It has been shown by a group in Germany using a cancer cell line. So what I can tell you is they looked in 2 cancer cell lines. They exposed those cell lines to contents of the vials, and then they looked for integration of this DNA. They did not find it in one of the cancer cell lines. They did find it in one of the others, and the other one. So again, that's proof of principle that it can happen. But what I like what Tim is saying here. I've been saying to the researchers that are looking at this, what we really need to see is, does this happen in normal cells, right? Because cancer cells are they're totally screwed up. Yep. So just because we see it in a cancer cell doesn't mean it's going to happen in the cells of an average person. And so I like what he's saying here. Remember, so this is interesting. Remember, I just told you about with the cancer research where I explained what the virus is, where we can take a cancer biopsy and actually pick individual cells. There you go. See, this is what he's talking about. They have the ability to do that. So what he's saying is take a real sample, right, from a person who has received these shots and start picking out single cells and seeing if there's integration. Because if you show that DNA is present in any of those cells from that person, that's real world data. That cannot, that is definitive proof that these things can genetically modify a person. Something, when we go back to what we talked about at the very beginning, we were told right from the get-go could never happen. Yeah. So yes, there are people who are interested. What I'd say, Tim, in particular, if you have this technology, I encourage you to contact Kevin McKernan. McKernan. He is sort of the global leader on this research that's being done in this area. He would love to know that you have technology and would like to contribute. So Kevin McKernan in the United States, please contact him.
Perfect. Cass asks, why would the industry switch to mRNA vaccines? What is wrong with the traditional way of delivering vaccines, like the live attenuated vaccines, for example? I'm just assuming because of timeline and trials and having to wait 10 years.
Yes, but if they did accelerated, if they allowed compressed, overlap of the clinical trials and all these compressed timelines and rapid review processes of the paperwork, it absolutely could be applied. There's no reason why. Now, I'm not encouraging that. All this vaccine development, we got to get away from this crazy idea of the speed of science being warp speed or something. The true speed of science is slow and plodding and methodical. So I don't encourage it for anything. But the reality is it's cheap and very easy, quick and easy to manufacture these modified RNA vaccines. But in other words, why couldn't we do the traditional? There's no reason why we couldn't. And remember, some of the technologies in the world were using traditional traditional methods for COVID-19 vaccines. It's just we didn't touch them with a 10-foot pole in Canada, right?
Yeah, that's right too. Yeah.
Yes.
Here's a question. I like to hear what Dr. Bridle says about how some people have had 7, 8, 9 shots with no issue and others are quite sick. Do you think it's a batch issue or it may be an underlying health issue? That's from Jennifer.
Yeah. So yes and yes to those. Yeah. There's no question. It has been shown. So for people like Dr. Jessica Rose studying the VAERS database, it's been very interesting. What they have found is when they started looking at batches, like batch numbers and associating those with adverse events, what was found is certain batches have absolutely been associated with disproportionately high numbers of associated adverse events. And then there's other batches that have been, some of them have been associated with no adverse events, to the point where, you've had this sort of conspiratorial thought, and well, actually I shouldn't say, because I'm not going to call it anything conspiratorial anymore. I'll consider everything as a possibility. But that's where people have come up with the idea that maybe some of the batches were saline. And that's where that idea came from. So there's definitely a batch issue. When my colleague David Speaker was looking at the batches here in Canada, and Kevin McKern in the United States, actually anybody who's done this has also found batch to batch variability. Some batches are much more contaminated with the plasmid DNA, for example, than others. So there's no question that batch plays a role. And of course, underlying health conditions. I would say just individual variability in general, and including things like even how the injection was given. So we know that there's certain injection techniques that can minimize the systemic biodistribution of these things. There's other ones that can maximize it. So for example, if somebody accidentally got an injection directly into a blood vessel in the muscle, they're going to have a much larger amount being distributed throughout the body. And so this is the thing. Why have we seen people take some people take a lot of doses and not have anything? And some people, after the first dose, experiencing something horrific? It's very individual. And see, this comes back. When I expressed my concern, Kerry and Chris, about that biodistribution, one of the studies I cited at the time, which nobody, again, gave me an opportunity to explain, I cited a study where they looked at 13 healthy healthcare workers. And in 11 of those 13, they found circulating spike protein. That's what I pointed to back in that interview as proof of principle that you could actually get circulating spike protein. Again, nobody even gave me a chance to address. My bigger concern was the fact that these things are designed to express the spike protein tethered to the surface of our cells, which makes our own cells a target of the immune response. But nevertheless, I use that. And that's a good example. It ties into this question. Because then all these fact checkers said, oh, look, Dr. Bridle doesn't know what he's talking about. And they even went to the authors of that paper and the absence of allowing me to interact in any way and said, this guy said, is using your paper as an example to get spike protein circulation. That could potentially be dangerous. And they gave the media what they wanted to hear. Oh, the method we used is extremely sensitive. You have to understand, these were very tiny quantities. These quantities were so small that we can't possibly see how they could cause any harm. To which, if anybody asked me, I would say, yep, I agree 100%. That's irrelevant to my concern. Why would I expect those concentrations to be causing harm in people that were perfectly healthy? Again, I remind people these were 13 healthy healthcare workers, fit, frontline healthcare workers, experiencing no adverse events. I use that as a proof of principle because as a scientist, I recognized in the people who are, if it can get into circulation, and that does contribute in any way to the harms, my hypothesis was that in people who are experiencing severe side effects, maybe in those people, the concentrations are much higher. And guess what? That was published and shown to be absolutely true, but nobody gave me an opportunity to provide that explanation, did they? And so, for example, I couldn't, I'm looking at it thinking, yep, nailed it again. When I saw the first case study of somebody who suffered a severe adverse event shortly after getting these shots. And guess what? The researchers looked at the spike protein. It was more than 100-fold higher in concentration than in those healthy healthcare workers. So yes, there's variability and there's differences. We're an outbred population. We're genetically diverse. We're exposed to different things. We respond very differently to things. So absolutely, there's those two factors that are in there. But then there's all these other individual variabilities and all these other things, technical variabilities. There's even batch to batch variation in how much modified RNA is in a shot, right? And the number of lipid nanoparticles that are in each one, right? And there's batch to batch variability on that. So there's so many variables. This is my concern, though, is that the more doses that a person gets, it's like Russian roulette, right? The more you increase your chance of harm. Again, why? I gave the example already, just lipid nanoparticles themselves have the potential to cause toxicity the more doses you get. And every single time, think about the technology. It just makes no sense to me. Again, it is designed to get cells in your body. So even if you want to pretend that it just stays in the shoulder muscle, fine. So you're going to have fibroblasts. You're going to have muscle cells that then get this genetic blueprint, and they're designed to then show this like a flag planted on the moon, right? Or on the top of a mountain. They display the spike protein. Now, all of a sudden, if you're getting this and you've already mounted an immune response against the spike protein, you're making your muscle cells, your fibroblasts in that shoulder region targets, right? So that even could be a potential for heart damage in some people, because if you start then triggering an autoimmune response against muscle, that might trigger spill over into the heart muscle for all we know.
Yeah.
So yes, there's many different variables that can mean that some people respond differently, and I'm thankful for all those people that did not suffer side effects. But this is what we have to understand. Yeah. This is the key that everybody needs to understand. The public messaging gives the impression that it's the vast majority of people by a country mile that have experienced nothing. That is based on taking our passive monitoring system in Canada, which is known as the CAFIS system, Canadian Adverse Events Following Immunization System, taking that as though that is representative of all the harm that has occurred. That is ridiculous. People didn't realize, it wasn't even disclosed to people. They were supposed to disclose any medical event that occurred after they got a shot to their physician. Their physician was not supposed to question that, and they were supposed to file an adverse event report about all those. That didn't happen. Even physicians who wanted to, sometimes didn't have the time to do so. Many people didn't realize they were supposed to report things. And most of us have friends and family or people in our circles where if you talk to them now, so guess what? I was interviewed yesterday, and when I was talking to the person in the interview, they were telling me that they had interviewed a person, and while being interviewed live in the interview, they shared that they had got the shots twice. And then they shared just matter-of-factly, and after the second one, I ended up with a blood clot. And the guy said, "Oh, did you report that to your physician?" No, I didn't. And so like we all know these people. And so what I will tell people is this: a passive monitoring system substantially underestimates, I believe, because of the politics around COVID-19. We know of physicians who did file reports and they were sent back. They were not accepted. They were rejected from the system. We know many people who suffered medical events that did not submit them. We know many cases where medical officers of health vetoed the reports before and wouldn't pass them along to the Public Health Agency of Canada. So what I'm saying is this: the harm from these vaccines has been substantially underestimated. To what degree, I can't tell you. I know it's substantial. I don't know exactly by how much. We'll never know because we didn't collect the data in a way that we will ever know.
Okay. This will be my last question because I know my laptop's going to die. So again, thank you, Dr. Bridle, for coming on. I'll let Chris wrap up the show, but this is a very good question. Dave asks, is there currently a definitive way to know if a person that gets sick right now has COVID or the traditional flu? Nobody seems to say anymore that they've got the flu. It always seems to be, I tested positive for COVID. And I know a few people that have said exactly that.
Yeah. So, okay. So this actually ties into a bit of a related question where some people say that the tests that we were using, the PCR tests, were actually detecting the flu. And we were calling it COVID. So I've got a lot of experience with PCR because, again, we've worked with viral vectored vaccines. We use PCR all the time. I'm very familiar with the technology and what was used here. And specifically, the technology is what we call reverse transcriptase PCR, just in case there's people monitoring and want to know, do I know what I'm talking about? So this is the thing. I can tell you, the test was properly designed to detect SARS coronavirus 2. It's very specific. There were multiple portions of SARS coronavirus 2 that had to be identified for the test to be positive. Were there massive issues with the PCR test? 100%. It should never have been used as the sole way to make a diagnosis of COVID-19. There was another cutoff. It never should have been used to declare people had the risk of making other people sick, because it does not tell you if the virus is viable or not. So there's many problems with the PCR. I'm not saying the PCR like overall is okay, but in terms of identifying the virus, yes, it was identifying SARS coronavirus 2 accurately. And sequence and quality control tests were done. Sequences were sent away, and they came back as the SARS coronavirus 2 sequence, not the influenza sequence.
Okay.
So yes, there is a definitive way, but this gets into diagnosis. There's a proper way to make a diagnosis. It's not by PCR. PCR is to be used as a diagnostic aid. It's supposed to give one piece of information that a diagnostician uses in the sum total of their toolbox. If you're going to make a diagnosis, first of all, remember somebody has to be sick. All these cases of COVID-19, we said, in many cases, people were never sick. The D in COVID is disease, coronavirus disease. So first of all, to be sick, a diagnostician will look at you and say, do you have signs and or symptoms of illness? If yes, then you are by definition sick. You have a disease. Then they try and make a diagnosis, and they're going to look. So for both COVID and the flu, so first of all, they have to have signs and symptoms that fit with a respiratory illness. And then yes, if you do a PCR, right? So if everything fits, and you are trying to differentiate by PCR, you can definitively tell the difference between influenza and COVID.
Okay.
It's amazing. Many people, when they got sick with something historically, would just automatically say, nobody would be doing testing. It could be a cold virus. It could be the influenza virus. But many people, I've got the flu. But you're right. But now the hip thing is, I got COVID, right? Because that's what everybody is perseverated on.
Yeah, that's right. All right. With that, I'm going to say good night. Thank you, Chris. You can wrap it up, or maybe even ask a couple more questions. And thanks again, Chris. For
it's actually I was 32 minutes from my bedtime, so we're gonna have to wrap it up anyway.
Okay. Well, I was gonna say thanks for dragging me out to do this. My burger has been made about an hour and a half ago, so I'm gonna go and do that and talk with some people in the bar over politics, because that's what I do. So I will see you guys. I'll see you tomorrow at an APP webinar that we're doing with Dr. Michael Wagner. So we'll talk to you guys later.
Awesome. Thanks, Kerry.
Take care.
Enjoy your burger. Speaking of burgers, I have a question for you. Do you like burgers?
I love burgers.
Okay. Well, when you make your way to Alberta for this event, I'd like to invite you to the Whistle Stop Cafe in Mirror, Alberta. That's my restaurant. And I know that you're pretty much aware of what went on in my restaurant and how things looked there during the pandemic. And I also want to let you know, to this day, I still have people show up at the restaurant daily, like a lot of times, maybe a dozen or so during a day. And they share stories about the impact to their lives that has occurred because of what we're talking about right now. I have lots of customers who have been injured shortly following their COVID-19 vaccinations. And of course, nothing was ever done about it. I have customers who are no longer with me, who passed away in a time frame that was consistent with their vaccinations. And I also have lots of people come in that share stories about, just family members that are offside with their views now, the classic things that we've been hearing this entire time. So I really hope you can make it out there. I'll buy you a burger. That would be an honor to have you there. And, maybe there might even be some people there that want to shake your hand and say thank you for what you've done, because if you look through the comments here, you've been a beacon of hope as well for a lot of people in this country and across the world in a time where everything seemed crazy and people thought that they were nuts for wondering what's going on. And then they see you with your experience and your depth of knowledge standing up and speaking the truth about this stuff. People really appreciate it. And as we were doing this podcast, I was texting some people within government, and they said the same thing. One of them even said, you're a true hero because you sacrificed your comfort and your, position to do the right thing for other people. So thank you very much for doing that. We appreciate it.
You're welcome, Chris. Yeah, I appreciate that. If I can get to your restaurant, I would love to. I'd love to see it. I'll see. I won't have a vehicle when I'm out there. I don't know exactly what my schedule will be, but if I can fit it in, I'd absolutely love to come and see you in person.
That'd be great. Yeah, time is always against us, it seems. It's I just realized recently that in 5 years I'm going to turn 50, and for some that might not mean much, but I'm still 25 years old in my head. So time seems to be moving a lot faster. And there's a lot of people out there, because of what's occurred over the last few years here, they're running out of time. And I'm really happy that these events are taking place. They're becoming more mainstream. The government is receptive and open to hearing this side. Because time doesn't stop for anybody. So this is great.
Yeah, I have to say kudos to this MLA that you everything that they can to open up the doors for discussion. Again, people have to look at this and wonder, why are there some of us who are standing in this gladiator arena, right? Others are the ones who have made this, turned this into a battle, right? A battle of wills, a battle of information, right? We're standing there in front of the public. We're willing to, debate these people. We're willing to talk to them. You saw that. I'll take whatever. I'll have people question whether viruses exist as a virologist, right? You questioned me about all vaccines and childhood vaccines. I don't shy away from any questions, right? And we shouldn't. We should be able to have hard discussions. So kudos to you guys out there in Alberta, right, for trying to promote this discussion. And what I say to these people, if you really do think we're spreading misinformation and propagating this to the public, why aren't you showing up at these public forums and correcting us and showing the public? And arguably you do it once and it's done, right? So I think it's great. And just so that you know, Chris, the reality is, for these misinformation, these people accused of spreading misinformation, they typically come up with 3 excuses. One is they don't want to show up to these events because they say, to tell the public, well, if we do, it seems to give some kind of legitimacy to this misinformation. It seems to elevate their platform. First of all, their own research shows that's not the case. It's what's technically called in their area of research the backfire effect. That's been proven to be incorrect. So anybody who says we don't want to give them a platform through misinformation is lying to the public. That scientifically has been shown to not be a risk. Secondly, we're talking to public anyways, right? So not showing up is not protecting the public from any messaging that we're providing. If you really think those people need to be protected from what we're saying. So secondly, they often say, well, we're not showing up. So one of the things I saw with this recent explosive emotional outburst, including from Timothy Caulfield, I saw a letter he sent directly to your MLA, where he said, well, these people, basically, these people have offended me. These people they've hurt my feelings. So why would I want to be around people like that? Come and hang around with people like that. To which I say, Timothy Caulfield, I never even knew who you were. I never even knew you existed before the declaration of COVID-19 pandemic. I learned who you are because members of the public started flooding me with messages of you attacking me behind my back constantly accusing me of spreading misinformation. And you have the gall now to tell people that, oh, well, Byram has now, defended himself. He's defended his reputation. He's actually told people, he's showing people that I, Timothy Caulfield, am actually spreading misinformation. Definitively showing this by showing the scientific studies which prove I'm spreading misinformation and saying things that are incorrect. And he's been defending himself with science. So for him to say, oh, my feelings have been hurt by this, I'm allowed to defend myself. I'm sorry, you're a coward if that's the excuse you're going to use. And finally, amazingly, Chris, do you know what the other excuse, the last remaining excuse that I've seen these people use is we don't want to show up to a public forum and do this in real time, a real time discussion, because some people are very good at theatrics, right? And they can mislead the public because they're very theatrical, and they might not have the facts on their side, but because they have this, because they put on this great performance, they win the audience over. To which I will personally say, Chris, I have Tourette syndrome. I have neurological tics, and that inherently makes me an introverted person. I do not like being in the public spotlight. Somebody like Timothy Caulfield, I will defer to him hands down. If it comes to performance, he's hip and he's suave, and he speaks in front of the public, and he speaks on mainstream media all the time, and he speaks in front of large audiences. So that's the most ridiculous excuse I've ever heard in my life. If anybody could win based on theatrics on stage between him and I'll give him the victory 100% of the time. So technically, and that from that perspective, I'm the one stepping up on stage with a disadvantage with somebody like him being beside me. But I will happily do that because I know that I stand firm on the science, that I actually am a true subject matter expert, and the science is on my side. And so what that leaves, Chris, is that leaves these people with no excuse to be showing up to these events. Zero. So we have to go to the fourth and final potential explanation as to why they show up. It's because they're cowards, and because they know that they do not their message does not stand firm on a firm scientific foundation. That is the only legitimate reason why they do not show up. And to this, Chris, just so people know, These people have an accepted invitation. I have a speaking time slot, as you know, and they're in Calgary. I will, up to the moment I step on stage, I will offer 50% of my speaking time to anybody who wants to come and legitimately try and legitimately convince the audience that I am presenting misinformation. Up to the moment I step on stage, I will give that person 50% of my speaking time. So these people have no excuse.
I wonder if Dina Hinshaw is listening.
If she wants, she can have 50% of my time. Chris, it's anybody.
I know exactly what you're talking about when you say Timothy talks about you hurting his feelings. Well, I've stood up for myself and defended myself against accusations towards me from people on our side, by the way, and it hurts their feelings, and that's what I get back. Oh, you're being divisive, you're hurting my feelings. Well, I'm sorry, but the facts don't care about your feelings. And if you're going to come after me, I'm going to defend myself. And you may get hurt feelings because of any of those things you described, like maybe they don't know what they're talking about. They're too cowardly. They don't believe that public debate is worthwhile, any of those things. But yeah, kudos to you for standing up to yourself against those types of things. It always sucks when you see people saying things about you that are obviously not true, and then you got to stand up and defend yourself. If all that energy could be spent, solving problems and working towards solutions, we'd all be in a better place. But unfortunately,
that's what we should all be doing. That's where these people have made a grave mistake. They're diverting energy and resources, massive energy and resources in the scientific and medical community from where they should really be invested. I agree with you, Chris.
Yeah, I get it. It's going to be a difficult thing because a lot of those folks have shaped their worldview and their actions and their interactions with other people based on the narrative that was presented by the media and the government. And now fighting just with facts, fighting with the science is very difficult because what we're really fighting is people's feelings. They are emotionally attached to that narrative because if they start questioning the narrative, they have to question everything they've done, everyone they've persecuted, and that is much more difficult than just learning something new. So, we will get through this, and I think if we have more public engagement and open debate, eventually the truth will be the only thing that stands the test of time, and we'll hopefully be there to see it happen. So thank you again for taking the time to do these types of things, specifically coming on our show. In a broader picture, thank you for the time you've devoted to pursuing this righteous battle that you've been fighting since you started questioning what's going on. I appreciate it. You gave me a lot of hope and some light when things were pretty dark, and I was wondering if we were going to make any headway. So yeah, thanks.
Yeah, well, it's been a pleasure, and thank you for giving me this opportunity to share with your audience. I really appreciate it, Chris.
Anytime. I've been looking forward to having you on for years. Well, since I first saw you speaking in Guelph, so it's a pleasure and an honor to have had you on. Again, thank you for your time. And folks, if your questions didn't get answered, we'll do our best to send Dr. Bridle a list of some questions to be answered. If we didn't get it to you, please don't take it to mean that we don't care. It's just busy, and we're on a limited time. So anyway, we'll do our best. Thank you very much. Good night, everybody. And I will see you in Calgary for the Injection of Truth on 13th?
January 17th. January 17th at 6 o'clock.
June 17th.
Oh, did I say January? Yeah, thank you. Yes. Yes. Yeah. June is 17th. Yes.
June 17th, 6 o'clock. There are still a few tickets available. And there's some tickets added for dinner with the scientists. So if you really have some important questions and you want to help support this event by purchasing a ticket to that, you can find it on the UCP's website under the events tab. Don't miss it. And if you can't be there in person, find a watch party or start one because this is going to be great. Good night, everybody. For all of you folks out there that find yourself on the same side of this conversation as me, namely kind of in the beginning, in the minority, feeling like you're standing against a massive tidal wave of ridiculous bullshit, the truth will set you free. Good night.